Yeah, so very good morning to all of you. Yeah, hello everyone. Yeah, I could see many of you are online right now. So very good morning. So anyone who is there online, can you please confirm me about audio and video? Audio, video, all fine. Anyone who is there online? Uh, yeah, Dr. Hemant, very good morning. Dr. Hemant, audio, video, all fine or not? Can you please confirm me? Yes, Dr. Harsh. Yeah, Dr. Sushma, Dr. UK. Dr. UK, are you from United Kingdom? Dr. Atul, Shivanand, a very good morning to all of you guys. Yeah, all fine. Yeah, thanks for the confirmation, Dr. Hemant, Atul, Sushma, Dr. Nitin Reddy, Shivanand, right, Dr. Madathif, Dr. SP7, Dr. Mohak. Yeah, a very good morning, Dr. Manasa. So, guys, we are going to start with this pharmacology lecture, and in next 6 days, we'll finish this pharmacology. So, 3 days class right now, and we'll have 3 days sessions more in next week. So I hope you all are ready with this roller coaster ride of pharmacology. Let me check how many of the students online at the second platform, that is your YouTube. So YouTube pe we people have just started this live lecture. It's free to air to everyone, the first session. And if anyone who is there online through YouTube, you can also send me hi or hello or good morning to me so that I'll come to know that you people are able to see me, you people are able to listen to me. So if anyone who is there, can you please give me the confirmation? Okay, so YouTube pe I can see around 72 people are online. So 72 people are online on YouTube. Okay, guys, in case you people are there, you can also send me hi hello over there. Okay, guys, let's start with this pharmacology. So the first topic, we'll start with the easiest topic of pharmacology, that is autonomic nervous system. We'll start with autonomic nervous system. So if I ask you this question, yeah, good morning. Yeah, now the YouTube people has connected with us. Okay, yeah. Good morning to everyone. Okay, guys, the regular batch students, the DBMCI regular batch students, can you please confirm me? Dr. Abdul Rahid, you people have to write in a separate notebook. Separate notebook, the workbook we will use on the fourth and fifth day. The workbook of pharmacology we will use on fourth and the fifth day. So first 3 days we have to write, then fourth and fifth day we'll use the workbook, right? Guys, which subjects you people have already covered? Which subjects you people have already covered? The DBMCI regular batch. So DBMCI regular batch, which subjects you people have covered so far, so that accordingly I will teach. Yeah, Muhammad Shan, fourth, fifth day we will use the workbook. Anyone who is there, can you please confirm me, guys, which subjects you people have covered in DBMCA so far? Like, which was your last subject? Yeah, Dr. Zach. Yeah, your PDF will be available to YouTube people after this session. Yeah, this is a live session, and you will get a PDF in case you want. Dr. Zach, Dr. Raj Patel. Hi. Yeah, physiology you people have covered. Okay, so in DBMCA you people have covered physiology, surgery, FMT, orthopedics. So surgery is already over. Obs gynae. Okay, some of you have already covered obs gynae. Okay, some of you have covered obs gynae, physio, orthopedics, FMT. These subjects are covered. Okay, fine, good. So you people are thorough with autonomic nervous system. So autonomic nervous system physiology you people have already covered. So just a quick revision of this autonomic nervous system physiology. Dr. Harshode has covered anatomy, microbiology, pedia, surgery, obs gynae, forensic medicine, orthopedics on obs gynae. Okay, good. So Dr. Harshode has covered obs gynae 2 times. Okay, very good, Dr. Harshode. You have covered obs gynae 2 times. It's very good. So let's start with this topic, autonomic nervous system. So who will tell me after, because you people have already covered physiology. So anyone can answer me what is autonomic nervous system? So autonomic nervous system is the one that will supply our voluntary muscle or involuntary muscle. Can any one of you answer me this question? Autonomic nerves are those nerves of the body which supply our voluntary or involuntary muscles. Very simple question based on the physiology. Autonomic nerves are those nerves that will supply our voluntary or involuntary muscle. Anyone would like to answer this question? Okay, involuntary muscles. Wonderful answer. So autonomic nerves are those nerves that will supply our involuntary muscles of the human body. Right? So autonomic nerves are those nerves that will supply our involuntary muscles of human body. So guys, we know that everything in human body is controlled by central nervous system. Everything in human body is controlled by central nervous system. Central nervous system, you must be knowing, central nervous system means brain and the spinal cord. So central nervous system means brain and the spinal cord. So CNS means brain and the spinal cord that will control each and everything in human body, including the peripheral nerves. So central nervous system is the one that will control everything, including the peripheral nerves. Now, peripheral nerves of the human body are those nerves which are present outside the brain and spinal cord. So any nerve that is present outside brain and spinal cord is known as peripheral nerves. Although the nerves are connected with CNS, the origin of these nerves is from CNS only. But when these nerves are present, as long as these nerves are present in central part, that is the brain and the spinal cord, we call them the central nerves. Once they will come out of the brain and spinal cord, we start calling them peripheral nerves. Now guys, we have two types of peripheral nerves present in human body. So we have two types of peripheral nerves present in human body. The first type of peripheral nerves are known as sensory nerves. First type of nerves are known as sensory nerves, and the second type of peripheral nerves are known as motor nerves. So we have two types of peripheral nerves. One is known as sensory nerves, second is known as peripheral nerves. And now I would like to use the knowledge of your physiology. If I say the nerve conduction, like sensory nerves give the signal towards the central nervous system, and motor nerves carry the reflexes from the CNS and supply to the periphery. So motor nerves carry the reflexes from CNS supply to the periphery, and the sensory nerves will take the signal from the periphery and transfer it to central nervous system. Now we know that the nerve conduction has an important role in this. So who will tell me what is the most important electrolyte that is required for nerve conduction? So most important electrolytes that is required for nerve conduction. Anyone can answer me this question? Which is the most important electrolyte that is required for the nerve conduction? How the nerves get depolarized and how the nerves get repolarized. So who will tell me which ions are involved in nerve depolarization and nerve repolarization? Very good. So Dr. MM, Dr. Kevin Joseph, you people have answered correctly. Very good. So we have sodium and the potassium ion. Very good. The sodium is required for depolarization of a neuron, and potassium is required for repolarization of a neuron. Sodium is required for depolarization. Potassium is required for repolarization of a nerve. Okay, now I would like to take the privilege of your physiology knowledge. The second thing I would like to ask you, out of the sensory and the motor nerves, which nerves are fast conducting nerves? The sensory nerves are fast conducting or the motor nerves are fast conducting? Like I will not say as a 100% rule, but generalize in a general way, but we say that like which nerves are fast conducting nerves? Sensory nerves or the motor nerves? So which nerves are fast conducting nerves, sensory or the motor nerves? So the answer is Dr. Prajwal has given the correct answer. Yes, Dr. United Kingdom also has given the correct answer. Yes, the sensory nerves. So sensory nerves are the fast conducting nerves. Very good. Dr. Atul, Dr. Hemant, all of you have answered correctly because you people have covered the physiology. So in physiology, this is covered that sensory nerves are the faster conducting nerves. So guys, please remember, because the sensory nerves are the faster conducting nerves, so they have the faster conduction in comparison to the motor nerves. They are more dependent. They are more dependent on the ions for their nerve conduction. So they have the slow conduction. Motor nerves have slow conduction. Sensory nerves have the faster conduction. So the electrolyte balance of the body, that is the sodium and the potassium ion, calcium ion, chloride ion. So electrolyte balance, whenever this electrolyte balance get disturbed, our sensory nerves are the first one to get affected because they are more dependent on the ions. The sensory nerves, which are the fast conducting nerves, they are more dependent on ions, or we can call them electrolytes also. So ions are also known as electrolytes. So we can say like this way, sensory nerves are more dependent on electrolytes for their proper functioning instead of the motor nerves, because motor nerves are the slower conducting nerves. Now, if I say the patient has got electrolyte disturbance, any idea which test we ask for the patient to undergo? If I want to know the electrolyte status of a patient, if I want to know the electrolyte status of the patient, which test we ask for the patient to undergo? Anyone can answer me that question? Like which test we write in OPD? Like patient should undergo this test, then only we will come to know the status of electrolytes in the patient body. What is the name of the test, guys? The name of the blood test is serum electrolytes. Very good. So we ask the patient to undergo serum electrolytes. Dr. MM, Dr. MJ, all of you have answered correctly. So serum electrolyte is the name of a test that we ask for the patient to undergo. And after the report will come, we'll come to know the electrolyte status of the patient. So whenever we have the electrolyte imbalance, in the body, like when we play outside, we have a lot of sweating, and because of sweating, we have a loss of fluids, we have loss of electrolytes. So we can have the electrolyte disturbances. So whenever we have electrolyte disturbances in the body, sensory nerves will get affected first, then the motor nerves. And whenever the sensory nerves are not able to work properly, we call that feeling as a paresthesias. So guys, we have a normal sensation, we call it esthesias. Whenever we have the abnormal sensation, we call it paresthesias. And whenever we have no sensation, that is known as anesthesias. So we have esthesias, paresthesias, anesthesias. So paresthesias is abnormal sensation. This will be seen in patients who suffer from electrolyte disturbances that can be of any reason. Now, if we talk about the sensory nerves further, we can divide sensory nerves in two categories. Sensory nerves can start from our voluntary structure, or sensory nerves can also start from our involuntary structure. So sensory nerves can start from our voluntary structure or the involuntary structure. So we have the nerves like somatosensory. So any component that starts from the voluntary structure, that part is known as somatic component. Any part that is related to involuntary structure of the body is known as the autonomic part. So that is known as autonomic part. So we have two types of sensory nerves. We have a somatosensory nerves. We have a autonomic sensory nerves. We have a somatosensory or the autonomic sensory nerves. Somatosensory nerves are those nerves that will come from our voluntary structure of the body. And autonomic sensory are those nerves that will come from our involuntary structure of the body. And both type of nerves are the fast conducting nerves. They are highly dependent on the electrolyte balance of the body. And collectively this system is known as sensory nervous system. So collectively this system is known as sensory nervous system. Right, guys? So collectively this system is known as sensory nervous system. And we have a group of medicines that you people will cover in your anesthesia class. The medicines are known as local anesthetic drugs. So we have a group of medicines, we call them local anesthetic drugs. So local anesthetic drugs are those drugs which can block our sensory nervous system. Right? So guys, we know that whether we talk about somatosensory or we talk about autonomic sensory, both the nerves have the same physiology. Like their nerve conduction is possible through electrolytes, that is sodium ion and the potassium ion. So local anesthetics are the medicines which can block our sensory nervous system. Right? So guys, any drug that ends with the word cane, is a local anesthetic, and that medicine is a blocker of sensory nervous system. Now my question is, whenever we give local anesthetic to a patient, what is going to be the mechanism of action? That is MOA. What is the mechanism of action of local anesthetic? If you give local anesthetics, it means you will have the loss of sensation. As the name suggests, anesthetics. So there is a loss of sensation. It means medicines will do something so that all the conduction through the sensory nerve will be blocked. Medicines will do something so that all conduction will be blocked. Now, how it is possible? And anyone, if you guess the mechanism of action of local anesthetics, how the local anesthetics can block the conduction through the nerves? Anyone would like to answer? So even the YouTube people can also answer. There is no harm in that. Yes, I can see Dr. Raj Patel, Dr. Sudh MBBS, Dr. Zach answered this question. Anyone can answer this question. What is the mechanism of action of these medicines? Very good. So Kevin Joseph has given the correct answer. Local anesthetics are those medicines which end with the word cane. Dr. Kiran Raj also has given the correct answer. That is blocking of sodium channel. So by blocking the sodium channel, these medicines can block the nerve conduction completely. Right? So these medicines can block the sodium channel. And if I increase the dose of the medicine, these medicines will also block the potassium channel to some extent. So medicines block sodium channel, medicines block potassium channel, medicines are local anesthetic drugs, and these medicines can block the sensation through the sensory nerves. Now, these medicines, whenever these medicines are given to a patient, first of all, these medicines will block the sensory nerves. First of all, these medicines will block the sensory nerves. But if you keep on giving these medicines for a long time, or if you give the medicines in higher dose, these medicines will also stop blocking the conduction of motor nerves. So initially the sensory nerves are blocked, later on the motor nerves get also blocked. And guys, let me tell you, whenever the motor nerves are blocked, what is the manifestation, how the patient presented to you? Like we know that, like when the sensory nerves are blocked, we will have the paresthesias, we will have the abnormal sensation, we will have the tingling sensations in our periphery. So tingling sensation, abnormal sensation, this is paresthesias. But whenever the motor nerves are blocked, any guess from your side, guys, how the patient presented to you? What is the main complaint of the patient whenever the motor nerves are not able to work properly? So assume patient has taken a medicine in higher dose. Very good. Dr. Prajwal has given the correct answer. Whenever the motor nerves are blocked, the patient will come to you with muscle weakness. See, you people are using the word paralysis, but guys, paralysis is something extreme, extremes of the muscle weakness. So we're not talking about the extremes. Just think that you people have gone and played cricket for some time, right? So, and after playing cricket or football for some time, like for 2 to 3 hours in a summer season, peak summer season, you people have gone and played the football. Now you will have the electrolyte imbalance. Now after that, you have that feeling that there is no power left in your muscles. So that fatigue, we call it, the word is fatigue. So that muscle weakness, that feeling of fatigue is known as the less activity of the motor nerves, right? So we call it muscle weakness. So patient can come to with muscle weakness, and no doubt, guys, when the motor nerves are completely blocked, obviously the patient will have the paralysis. The word that you are using, this is absolutely correct, and I'm really salute to your knowledge, because people at your level generally not able to answer these kind of questions. But if you are able to answer this kind of question after physiology, it's very good for you. So we have the local anesthetics, the medicines name end with the word cane. Any example of the medicine can you give me? Any drug you know that name ends with the word cane? Any drug you know that is a local anesthetic? Any drug you know that is a local anesthetic ends with the word cane? Any drug that you know that ends with the word cane? Yes, very good. So one of the drug is lignocaine. So one of the drug is bupivacaine, lignocaine, prilocaine, procaine. All these medicines are local anesthetics. Cocaine is also a local anesthetic, guys. Anybody use cocaine in your clinical practice? No? Okay, no problem. Guys, why we call them local anesthetics? Why we call them local anesthetics? Are these medicines belong to local brand? Are these medicines local or branded? Anyone can answer? Medicines are local anesthetics. So why we call them local anesthetics? Are these medicines local or these medicines are branded? Anyone? Why we call them local anesthetics? No answer. Yes, Dr. Kavya, Dr. VK, Dr. Sudh, you people have given the correct answer. Yes, we call them local anesthetics because these medicines are given by the local route. Very good. So these medicines are given by the local route. That's why we call them the local anesthetics. So these medicines are branded actually, but they're given by local route. That's why we call them local anesthetic drugs. Okay, now, so this is the one aspect that we have covered, that is a sensory part. Now let's talk about the motor nerves. Now motor nerves can again be classified in two groups. So based on the muscles they supply, these nerves can also be of two types. So these nerves can be the somatic motor nerves, and these nerves can be the autonomic motor nerves. So these nerves can be autonomic motor, these nerves can be somatic motor. So if the nerves will supply the voluntary muscles, if the nerves will supply voluntary muscles, we call them the somatic nerves. If the nerves will supply involuntary muscles, so the nerves will supply involuntary muscles, we call them the autonomic nerves. Now starting with the somatic nerves. Somatic nerves are those nerves that will supply our voluntary muscle. Now this is known as somatic nervous system. This is known as somatic nervous system. So in this somatic nervous system, we have a presence of a motor nerve and the sensory nerve, and the motor nerves will supply our voluntary muscles. Now, which are the voluntary muscles of human body? So one is known as skeletal muscles. So somatic nerves are the one that will supply our skeletal muscles. So one muscle is skeletal muscle. That's a voluntary muscle supplied by the somatic nerves. Second type of muscles which are voluntary in nature are known as the somatic muscles. So guys, if I say your facial muscles are also voluntary muscle. Like you can change your facial expression. So you can change your facial expression, you can move your eyeball, you can move your tongue also, you can protrude your tongue, you can take back your tongue, you can move your eyeball, you can change your expression, you can give me the smile, you can frown also, you can do the lip smacking, you can do the lips puffing, lips pouting for the selfies and all. So you can move your facial muscles uh, as per your desired action. So these facial muscles are also voluntary muscles, but they are not the skeletal muscles. So try to understand skeletal muscles are those muscles which participate in body movements. But facial muscles are voluntary, but they don't participate in body movements. So we call them the somatic muscles. So we have two types of muscles which are voluntary. One is known as skeletal muscles, second is known as somatic muscles, and these muscles are supplied by the somatic nerves, and the system is known as somatic nervous system. So somatic muscles are those muscles which are derived from special embryo arches. So these are the muscles which are derived from special embryo arches. We call them the somatic muscles. Now, here in this somatic nervous system, the somatic nerves will make a junction with a muscle. We call it neuromuscular junction. So here we have a presence of a basic unit. We call it neuromuscular junction. So in this neuromuscular junction, the nerve is present. Nerve will release a neurotransmitter that will act on a muscle that is known as neuromuscular junction. So here you people have to answer me which neurotransmitter is released in neuromuscular junction. What is the name of a neurotransmitter that is released in neuromuscular junction by the somatic nerve? What is the name of a neurotransmitter and what is the name of a receptor present over here? Can any one of you answer me this question? Yes, Dr. Basid Salam has given the correct answer. Dr. UK, Dr. Athul, Meghna, Kiran, TS. How many of you are there online? So I cannot take all the names. Dr. Chinmay, Dr. Gagana, Dr. Harshoday, JJ, Shivanand. All of you have given the correct answer. Here the neurotransmitter released in this neuromuscular junction is acetylcholine. So the name of the neurotransmitter released in neuromuscular junction is acetylcholine. Yes. So acetylcholine will act on an end plate receptor. What is the name of a receptor? Yes, the name of a receptor is nicotine M type of receptor. So acetylcholine will act on nicotine M type of receptor. So from this word neuromuscular junction, you can take out the name of the receptor. So the name of the receptor is NM receptor. It's a nicotinic receptor muscle type. It's a nicotinic muscle type of receptor. We call it NM receptor. So acetylcholine will act on NM receptor. And guys, what is the outcome? The muscle will be contracted or get relaxed. So please remember, whenever this acetylcholine will act on NM receptor, the muscle is always contracted. So whenever acetylcholine will act on NM receptor, the muscle is always contracted. There is no point of relaxation. So please remember, these are the voluntary muscles. As long as you want the contraction, as long as your brain wants the contraction of your muscles, the acetylcholine is continuously released. So acetylcholine continuously released in your body in that particular neuromuscular junction where the brain wants to have the muscle contraction. And when brain wants to relax that muscle, the neurotransmitter release is blocked. So as long as acetylcholine is released, the muscle will be contracted. The moment we want to relax the muscle, the neurotransmitter release will be blocked. Now here we have a group of medicines. We have a group of medicines which can block this neuromuscular junction. We have a group of medicines which can block this neuromuscular junction. The medicines are known as skeletal muscle relaxants. So medicines are known as skeletal muscle relaxants. So skeletal muscle relaxants are the medicines which can block this neuromuscular junction by blocking the NM receptor. So skeletal muscle relaxants, mechanism of action, these medicines can block the NM receptor, and by blocking the NM receptor, these medicines can relax the skeletal muscles. These medicines can relax our voluntary muscle. So we call them skeletal muscle relaxants. So skeletal muscle relaxants, mechanism of action, they are the blocker of NM receptor. So any medicine you find that ends with the word curium, curare or curonium. So any medicine that ends with the word curium or curonium, these medicines are skeletal muscle relaxant. So any drug that ends with the word curium, curonium, curare, these medicines are neuromuscular junction blocker. We call them skeletal muscle relaxant. Any example, guys, you can give me? Any example of the drug you can give me? The medicines which end with the word curium, curare? Any example you people can give me? The medicine name ends with the word curium, curonium. Okay, yes, very good. So, yes, very good. So, one of the example is like atracurium, V curonium, pancuronium, pipecuronium, cis atracurium. All of you have given the correct answer. So, these medicines are curium and curonium. These medicines are skeletal muscle relaxants, blocker of NM receptor. This is what we have discussed about the somatic nervous system. Now, guys, we have one more group of medicines, the medicines that will act on our central nervous system. The medicines are known as general anesthetic drugs. So, we have a group of medicines, we call them general anesthetic drugs. Now, general anesthetic drugs are those medicines that will act on our central nervous system. So, we have a GA drugs, general anesthesia medicines that will act on our central nervous system. Now, most of the medicines will act on GABA pathway. I will not say all the drugs, but most of the medicines will act on GABA pathway. Now, use the knowledge of the physiology. Please tell me GABA pathway is a stimulatory pathway or the inhibitory pathway. I would like to know from you people, this GABA pathway, this GABA pathway is a stimulatory pathway or the inhibitory pathway. Can any one of you answer me this question? Yes, this is a type of inhibitory pathway. So GABA pathway is a type of inhibitory pathway. So general anesthetic drugs will stimulate this GABA pathway and can inhibit the centers of the central nervous system, inhibit the central nervous system centers, and these medicines are used as a general anesthesia drugs. Right, guys? Now, can any one of you tell me what is balanced anesthesia? So what is balanced anesthesia? So balanced anesthesia is a technique. Balanced anesthesia is a technique where we achieve unconsciousness, where we achieve the patient unconsciousness by giving the general anesthesia drug, where we achieve the unconsciousness by giving the general anesthesia drug. So whenever we give anesthesia to a patient, we want to achieve the unconsciousness. We want that patient muscles should be relaxed. We want that patient skeletal muscles should be relaxed. We want that patient should be unconscious. Patient muscles should be relaxed. Patient should not remember anything. Patient should not remember anything, whatever happened during the surgery. We want amnesia, and we also want the analgesic effect. We want that patient should not feel the pain during the surgery. So during anesthesia, we want four important things. We want that patient should remain unconscious. We want that patient muscles should remain relaxed. We want that patient should not remember anything. And we want that patient should not feel the pain. Now, guys, all the four aspects of anesthesia can be achieved by giving the general anesthesia drugs. So, general anesthesia drugs are so strong medicines that they can block all the centers of CNS, and ultimately everything is controlled by CNS. So, this medicine can achieve all the four things. But there is a important thing. The important thing is, for this purpose of achieving all the four things, for the all four objectives, the GA drugs need to be given in very high dose. And whenever we give GA drugs in high dose, there is a risk that patient can land up in coma. So patient can land up in coma when we give GA drugs in very high dose. So guys, what do we do? We give general anesthesia drug along with some other drugs. We give some supportive medicines along with GA drugs to achieve all the four objectives. But when we give the other supportive medicines along with GA drugs, we have to give less dose of GA drugs. And when we give the less dose of general anesthesia drugs, the risk of complication, the risk of patient landing in coma is also going to be less. So guys, who will tell me which medicines we use for the purpose of skeletal muscle relaxation? The answer is curium and curare. So this is the role of curium and curare that we have covered. So medicines which are curium and curare, these medicines are blocker of nicotine M receptor, and these medicines are given by IV route. These medicines are given by IV route during the general anesthesia, and the basic purpose of giving the medicines is to keep the muscles relaxed, and so that we require the less dose of GA drugs. Now, can any one of you tell me from the knowledge of your anesthesia subject, which medicine we use during anesthesia for purpose of analgesic effect? So analgesic effect, the pain-killing effect. The pain-killing effect of the anesthesia is achieved by giving which group of medicine? The answer is opioids. So we have a group of medicines like opioids. Like there is a group of opioids, we call them fentanyl group of medicines. We have a group of opioids, we call them fentanyl group of medicines. So fentanyl group of medicines are given for purpose of analgesia. Skeletal muscle relaxants are given for skeletal muscle relaxation. Unconsciousness is issued by GA drugs, And amnesia can be achieved by combined GA drugs or by giving some benzodiazepines. So benzodiazepines and general anesthesia can achieve the purpose of this amnesia. So guys, this is known as balanced anesthesia, where we give a cocktail of 4 or 5 medicines. And when we give this cocktail of medicines, patient, all objectives of the surgery will be achieved without having any complication. So this is the concept of balanced anesthesia, and that is what we have discussed. So if I ask you this question, what is the role of skeletal muscle relaxant? What is the role of skeletal muscle relaxants in day-to-day practice? Answer is skeletal muscle relaxants are given by IV route, and these medicines are used during anesthesia. So these medicines are used during surgery, during anesthesia to achieve the skeletal muscle relaxation. These medicines are never been given in OPDs. So guys, skeletal muscle relaxants are never been used in OPDs by oral route. They are the IV routes. They are the very strong medicines. They can paralyze all muscles of your body, including the diaphragm. So these medicines we use during anesthesia. Now we have a fourth group of medicines you can see. So 3 group of medicines we have discussed so far. We have discussed about local anesthetic drugs, you can see. So local anesthetic drugs are blocker of the ions, that is sodium ion or the potassium ion, and these medicines can block the sensory nervous system. We have talked about skeletal muscle relaxant. These medicines are blocker of the somatic system, the motor component. So motor component of somatic system is blocked by the skeletal muscle relaxant. All medicines end with the word curium and curare. The third group of medicines we have covered, that general anesthesia drugs, and general anesthesia drugs are the one that will directly act on CNS, block the centers of the CNS. Now these 3 group of medicines you people will cover in detail in your anesthesia subject. Today in pharmacology, we are going to talk about the fourth group of medicines, the medicines which are motor nerves. We are going to talk about the motor nerves that will supply our involuntary muscles, and these nerves are known as autonomic nerves. And the system that we are going to discuss today is autonomic nervous system. So this is a system that we are going to discuss today. We call it autonomic nervous system, where the nerves will supply our involuntary muscles, and involuntary muscles are smooth muscles. So we have the smooth muscles, we have the cardiac muscles. So the nerves can supply the cardiac muscles and the smooth muscles or any involuntary structure of the body. We call them the autonomic nerves. Now in this autonomic nerves, guys, we have 2 types of nerves. So God has given us 2 types of autonomic nerves, like somatic nerves only of 1 type, sensory nerves only of 1 type, but autonomic nerves can be of 2 types. So guys, here you people have to answer, what are the 2 types of autonomic nerves present in human body? Use the knowledge of your physiology and answer me this question. Autonomic nerves are those nerves that will supply our involuntary muscles. How many types of autonomic nerves we have present in our body? So we have 2 types of autonomic nerves. We have 2 types of autonomic nerves present in human body. Yes, one is known as sympathetic nerves. One is known as parasympathetic nerves. And these are the nerves that we are going to discuss today. And also we are going to discuss about the drugs that will act on this autonomic nervous system. Very good. So I'm really impressed to see that you people are participating in the discussion. And the best part is you people are participating, and above all, you people are answering correctly. So this is also very important that you people are having that concept of autonomic nervous system in your mind. Then only you are able to answer all this question. And guys, this is how you people will learn. Like once you participate in the class, once you answer these questions, whatever the faculty asked in the class, this is how you train your mind. This is how your brain will train itself to answer in the exams. So once you start answering the questions which are randomly asked to you, the same way the questions will be put or asked in the exams randomly in front of you in your computers. So this is how you have to train your mind with time. Very good. I'm really impressed with this batch, which is a DBMCI regular post-intern batch. Okay, so what we have discussed so far? We are going to discuss about the autonomic nerves, which are 2 types of nerves. One is known as, first type of nerves are known as parasympathetic nerves. Second type of nerves are known as sympathetic nerves. So we have 2 types of autonomic nerves present in human body. So guys, although we have 2 types of autonomic nerves, one is parasympathetic, one is sympathetic. But let me tell you, at a given point of time, we required only one nerve. Like when we required parasympathetic, we don't require sympathetic. And when we require sympathetic, we don't require parasympathetic. So although God has given us 2 types of autonomic nerves, sympathetic and parasympathetic, but at a given point of time, we required only one nerve, parasympathetic or sympathetic, right? Now, who will tell me in which situation of the life we require sympathetic, and in which situation we require parasympathetic. I'll give you two options. There is one stressful condition and second is non-stressful condition of the life. So during the stressful condition of the life, we require which nerves to get activated, and during the non-stressful stimulus of the life, which nerves get activated. So you have to choose between two options, guys. Stressful and non-stressful. Very good. Flight, fright, and fear. That's a stressful state of the life. So guys, very simple. The S stands for sympathetic. S stands for stressful stimulus to your human body. So whenever we have the stressful stimulus to our human body, our sympathetic system get activated to fight with that stress. But as long as we are in non-stressful environment, as long as we are in non-stressful environment, we have a non-stressful stimulus to human body, our parasympathetic system remain activated all the time. So non-stressful environment, parasympathetic system remain activated all the time, and stressful environment, sympathetic system remain activated all the time. Right, guys? So if I ask you this question, most of the time of the day, most of the time of the day, most of the phase of our life that we spend on this beautiful planet so-called Earth, right? So which system remain activated all the time? So what is the name of a system that remain activated all the time of the day in a normal human being? I'm not talking about doctors. If we keep doctors on one side, most of the time in other human being, this system remain activated. Answer is parasympathetic system. Very good. So parasympathetic system most of the time remain activated. So whatever normal activity we do in day-to-day life, like we eat food, we absorb food, we assimilate food, we take out energy out of the food, we excrete, we urinate, we have multiple things going in our body. All these things are regulated by the parasympathetic nerves. But during these activities of day-to-day life, whenever we people come in stress, our sympathetic system will take the driver's seat and now it will handle the stress. And once the stress component is over, again this sympathetic system is off and parasympathetic system again will come into the picture and play the role and will control each and every component of the body. So wherever we people will come in stress, our all normal activity of the body gets switched off. Like we people cannot digest the food properly. We cannot assimilate the food. We cannot take out the energy out of the food. We cannot excrete. We cannot urinate. Our all process of the body will get impaired for a time being whenever we people come in stress. Like right now I'm taking this pharma lecture. So taking a pharma lecture is routine for me. So right now I'm teaching on my parasympathetic system. Got it? So right now I'm teaching on my parasympathetic system because I'm relaxed right now and taking up pharma lecture is routine for me. Now while taking the pharma lecture, if I fall down, so if I fall down from my chair while taking the pharma lecture, immediately what will happen? My sympathetic system got activated because I'm not used to this fallen activity, this fallen action. When I'm not used to this fallen action, my sympathetic system got activated, and this sympathetic system will take care of my stress that has occurred while falling. Now, immediately I will control myself, I will sit back to my chair, and now again my parasympathetic will get activated. Right now, you people are sitting at your home. You people may be in your beds, maybe in your sofas, maybe in your study table. You people are relaxed right now listening the lecture. But if I point any of you, like if I point Dr. Atul, Dr. Atul, can you please tell us, Dr. Atul, can you please tell us what is somatic nervous system? Now this question is to Dr. Atul. Now we will assess how much Dr. Atul have understood from this lecture. Dr. Atul, what is somatic nervous system? So now Atul is not able to answer. Dr. Atul is missing. Dr. Atul has gone somewhere. Dr. Atul, are you there? Or shall we move ahead? So this is how Dr. Atul's sympathetic system get activated, right? So the moment 1 minute back, Dr. Atul parasympathetic system was active. He was listening this lecture carefully. The moment I have taken his name, Dr. Atul, now his sympathetic system got activated. He got conscious that sir has taken my name. Now again, he knows this thing that I have used his name just to explain this sympathetic and parasympathetic phenomena. Now again, Atul is relaxed. Atul is smiling. And now Atul parasympathetic system is again activated. So this is how this system will switch between each other whenever we have the stressful and the non-stressful events of the life. Now, if we talk about this parasympathetic system further, who is this Dr. RJ who is giving this in your group? Who is this Dr. RJ? Shall I ban him? This Dr. RJ is keep on spamming in between this group. Okay, right. Okay, fine. So now let's talk about the other points about parasympathetic system. Now, guys, the other name of parasympathetic system is craniosacral outflow. We also call this system as craniosacral outflow because there are some cranial nerves and some sacral nerves which are known as parasympathetic nerve. And if we talk about sympathetic system, this is thoracolumbar outflow. So this is thoracolumbar outflow. So thoracolumbar outflow, there are some thoracic and the lumbar nerves which are sympathetic nerves, and there are some craniosacral nerves which are parasympathetic nerves. So if I ask you this question, which cranial nerves? So which cranial nerves are the parasympathetic nerve? What would be the answer? So which cranial nerves are the parasympathetic nerves? And sacral nerves are easy to understand. This is from S2 to S4 vertebra. This will form a plexus. We call it sacral plexus. So this will form a plexus. We call it sacral plexus. Very good. So you people have given the correct answer. There are four cranial nerves. There are four cranial nerves which are parasympathetic nerve. So we have the cranial nerves 3, 7, 9 and 10. So there are four cranial nerves 3, 7, 9 and 10 which are known as parasympathetic nerve. So 3, 7, 9, 10 are the four nerves of the cranium that are known as parasympathetic nerves. Sacral nerves S2 to S4. In thoracic outflow we have T1 to T12 vertebra, and in lumbar we have the nerves coming out up till L2 or L3 vertebra. So nerves are coming out from L1 to L3 vertebra. That will form a plexus. We call it lumbar plexus. We call it lumbar plexus. We have a sacral plexus. So lumbar plexus is an example of sympathetic outflow, and sacral plexus is an example of this parasympathetic outflow. Here the important point is this only. So in case you cannot remember other thing, it's fine. Just remember 3, 7, 9, 10 are the four cranial nerves which are known as parasympathetic nerve. I just want to know the name of 10th nerve because the most important nerve here is 10th nerve. Who will tell me which nerve is a 10th nerve? What is the name of our 10th nerve? So 10th nerve is the most extensive course in the body. What is the name of the 10th nerve? The answer is vagus nerve. Very good, Dr. Kevin Joseph, Dr. Basit, Dr. Basit. Very good. Dr. Harshoday, Dr. Abdul, Dr. TS, Dr. SS, Dr. Reddy. All of you have given the correct answer. It's a vagus nerve. Okay, guys. Now, I just want to know the neurotransmitters. What is the name of a neurotransmitter released by parasympathetic and the sympathetic nerve? What is the name of a neurotransmitter and what is the name of the receptor? What is the name of the receptor on which this neurotransmitter will act? So what is the name of a neurotransmitter? What is the name of a receptor on which this neurotransmitter can act? Very good. So in parasympathetic system, the name of the neurotransmitter is acetylcholine again. So in parasympathetic system, the name of the neurotransmitter is again acetylcholine. So this parasympathetic system is also known as cholinergic system. So this system is also known as cholinergic system because of the acetylcholine. Because of the acetylcholine. So because of the acetylcholine, this system is known as cholinergic system. And who will tell me the name of a receptor on which acetylcholine can act? What is the name of a receptor on which acetylcholine can act? Now the neurotransmitter that is released in sympathetic system is noradrenaline. The name of a neurotransmitter is noradrenaline, which is also known as norepinephrine. So noradrenaline, norepinephrine is the name of a neurotransmitter. That's a part of this sympathetic system, and that's why this system is also known as adrenergic system. So this system is also known as adrenergic system. Now, what is the name of a receptor? Yes, the name of the receptor here is muscarinic receptor. So parasympathetic system, the name of a receptor is muscarinic receptor. So on the surface of all muscles, on the surface of all involuntary muscles, we have a muscarinic receptor. On the surface of all involuntary muscles, we have a muscarinic receptor. Now, if I ask you this question, on the surface of all voluntary muscles, we have which receptor? So you guys, here you can make a generalized concept. On the surface of all voluntary muscles, that's the somatic system I'm talking about. If I'm talking about the somatic system, what is the name of a receptor present on the surface of all voluntary muscle? Very good. So on the surface of all voluntary muscles, we have NM receptor. On the surface of all involuntary muscles, we have muscarinic receptor. Neurotransmitter is same. So neurotransmitter is same in somatic system as well as the parasympathetic system. Parasympathetic system is the one that remain activated all the time, and even the somatic system is the one that remain activated all the time. So our somatic system and parasympathetic system remain activated all the time. Somatic system will take care of the voluntary component, and parasympathetic system will take care of our involuntary component. That will take care of our involuntary component. That is a parasympathetic. The receptor in somatic system is NM receptor. Receptor in parasympathetic system is muscarinic receptor. But there is only one exception. The exception is whenever we people come in stress. Whenever we people come in stress, our sympathetic system get activated and parasympathetic gets switched off. So whenever we people come in stress, our sympathetic system get activated, and whenever sympathetic system get activated, in voluntary system, the same system that is a NM receptor remain activated. But in autonomic system, but here in involuntary system, the sympathetic system will release noradrenaline or the norepinephrine, and this will act on two receptor, that is alpha or beta receptor. So this will act on alpha or beta receptor. So here the receptors are alpha or beta. So noradrenaline and norepinephrine will act on alpha beta receptor and can help us to fight with the stress. So this is the difference between sympathetic and the parasympathetic system that we have covered. Now, after that, guys, there is a common point in both sympathetic and parasympathetic. The common point is there is a common point to both, common feature of both sympathetic and the parasympathetic system. So what is the common feature? The common feature is in both parasympathetic and the sympathetic system, wherever we have the presence of nerve and nerve junction. So wherever we have the presence of nerve and nerve junction in autonomic system. So whether we talk about parasympathetic system or we talk about sympathetic system, wherever we have a presence of nerve and nerve junction, that is known as ganglia. So that junction is known as ganglia. So in autonomic system, wherever a nerve will make a junction with other nerve, not with a muscle, right? So wherever a nerve will make a junction with other nerve, that structure is known as ganglia. Now in this ganglia, again the neurotransmitter released is acetylcholine, and here the receptor which is present in this ganglia for the nerve conduction is totally different. So neurotransmitter is acetylcholine, but the receptor is totally different. The name of the receptor is nicotine N type of receptor. It's a nicotine neuron type of receptor, nicotine N type of receptor, or we can remember like this way, nerve junction, we have double N. So here the receptor is double N. So the type of receptor present on nerve is nicotine N type, nicotine neuron type. But the type of receptor present on muscle is nicotinic muscle type of receptor. So we have a nerve junction, we call it ganglia in autonomic system. Here again the neurotransmitter is acetylcholine, the receptor is nicotine N. This is all about the general aspects of autonomic nervous system. Guys, in case you have any doubt up till here, so please ask. In case you people have any doubt up till here, please ask, because after that I will start with the first system, that is a parasympathetic system in detail. So I will start the first system after this. So in case guys you people have any doubt, please ask me. Yes, Dr. Zach has asked a question on YouTube. Whenever we give skeletal muscle relaxants can paralyze your all skeletal muscles, like the body limb muscles as well as the facial muscles. Like Dr. Zach, you must have heard about this block, this optic blocks. So like whenever we have to do some ophtha surgery, we have to give a block before that. So we give skeletal muscle relaxants in eyes. So our all eye muscles, that extraocular muscles get paralyzed. So we give a optic block, and because only after that the eyeball movements get paralyzed and we can perform the surgery. So skeletal muscle relaxants can paralyze both type of muscles, skeletal as well as somatic muscles. Okay. Now guys, any doubt up till here? No doubt. Okay. Let's move on to the next topic. When will ganglia be stimulated? Okay, Dr. MJ has asked a question. When will the ganglia be stimulated? So guys, ganglia is stimulated whenever the nerve conduction will come. Like if I say this is the ganglia, so this is the one nerve that is coming and the other nerve is going out. So this is the nerve number one that is coming and the other nerve is going out. So whenever this nerve is stimulated by the brain, when the first nerve is stimulated by the brain, the signal is coming from the brain. So this nerve will release. This nerve will release acetylcholine over here. Now signal is transferred to nicotine N receptor, and now the signal has gone to the second nerve that will ultimately go and supply the peripheral muscle. So the second nerve will supply the peripheral muscle. So in this way, the nerve gets stimulated in the ganglia. So one nerve can stimulate the other nerve in this ganglia. Right? So this is how this nerve conduction will take place. Any other doubt, guys? Okay, let's start with the first system. The first system is known as the cholinergic system. So first system is known as the cholinergic system. Yes, Dr. MJ. This will happen both during stress and non-stress. So this will happen. This nerve conduction is possible in both stress as well as non-stress. The only thing is, like whenever you have stress, your sympathetic system, which is regulated by the brain, this get activated. So during the stress, sympathetic component will come out, and during the non-stress, parasympathetic system will get activated, and accordingly the nerve is stimulated in the periphery. Right? So a pathway is same. So in both sympathetic and parasympathetic, we have a common pathway. That the nerve conduction is possible. The nerve and nerve conduction, or the signal is transferred from one nerve to the nerve with the help of this ganglia. Now, if we talk about this cholinergic system, we have already covered. In cholinergic system is known as cholinergic because of the acetylcholine. So because of the acetylcholine, the system is known as cholinergic system. So the first thing is, I will ask you, what are the nerves? Which are the nerves in the body are known as cholinergic nerves? So which nerves are cholinergic nerves? Number one, that we have already covered. All somatic nerves. All somatic nerves of the body are cholinergic nerves. They can release acetylcholine. Number two, all parasympathetic nerves. All parasympathetic nerves are also cholinergic nerves. So all somatic nerves are cholinergic. All parasympathetic nerves are cholinergic. This is what we have covered. Now, who will tell me which receptors are present? Number three, all nerves present in autonomic ganglia. All nerves present in autonomic ganglia are also cholinergic. They also release acetylcholine. Now, who will tell me which receptors are present over here? So I have given you three questions. All somatic nerves are cholinergic. All parasympathetic nerves are cholinergic. And all nerves present in autonomic ganglia are also cholinergic. But every time the receptor is different. So who will tell me the names of three receptors? You have to type one message. In one message, you have to write three words. You have to tell me the names of these three receptors. So all somatic nerves are cholinergic. They release acetylcholine. All parasympathetic nerves are cholinergic. They release acetylcholine. All nerves present in autonomic ganglia. This can be sympathetic. This can be parasympathetic. So these nerves are also cholinergic. They release acetylcholine. But the receptors are different every time. So here in this first case, the receptor is NM receptor. So here in this case, the receptor is NM receptor. In second case, the receptor is muscarinic. And in third case, the receptor is nicotine N type. So here the receptor is nicotine N type. This is what we have discussed. So these are the three types of nerves that we are going to discuss now. Now, in these three types of nerves, we know that acetylcholine synthesis will take place. So now we will discuss how the acetylcholine synthesis and its release takes place from these nerves. So acetylcholine synthesis and the release will take place in these nerves. We'll discuss now how the acetylcholine synthesis will take place. So guys, very simple. We have a presence of acetyl CoA in the body. So this acetyl CoA combines with choline. This acetyl CoA combines with choline in the presence of some enzyme. That enzyme name is not important for you. That's why I will not tell you the name. So acetyl CoA combines with choline in presence of an enzyme, and that will form acetylcholine. So acetylcholine synthesis is a very simple process. Acetyl CoA combines with choline with the help of an enzyme, and now the acetylcholine synthesis will take place. And now this acetylcholine synthesis which has taken place, this acetylcholine will be shifted to a vesicle. So this is a vesicle present in the body. So vesicles are the storage granules. Vesicles are the storage granules for the neurotransmitters. So neurotransmitter is acetylcholine that is synthesized over here. Now this acetylcholine will be shifted to the vesicle, and this is our cholinergic nerve. So we have discussed, we have three types of cholinergic nerve, and we have just drawn the structure of one of the cholinergic nerve. So this is our nerve. So this is our one of the cholinergic nerve. Now in this cholinergic nerve, acetylcholine synthesis will take place after acetyl CoA combines with choline in the presence of an enzyme. So acetylcholine, okay, Dr. Darde Disco, we will add him back. No problem at all, guys. I mean, it was not a mistake. It was just because that other students are getting disturbed. Like, I mean, you people are adult enough. You people can do anything in the group. There is no problem at all. So, like, we people are not that much big enough or that much elder enough to tell you that this is the right thing, this is the wrong thing. But the only thing is the other students are getting disturbed. So you people are free enough to do anything. Like it's your life. Like you can do anything. So I'll add him. I will add him back. No problem at all. Just send him. Just tell him to send the request. I will add him. Right? Okay, no problem. So acetyl CoA plus choline combines with each other, forms acetylcholine that is stored in the vesicle. Now, whenever body requires, acetylcholine is released. So whenever body requires, acetylcholine is released. So signal will come from the brain. So signal will come from the brain, and when this signal will come from the brain, the signal will reach at the periphery of the nerves. And when the signal will reach at the periphery of the nerves from the brain, there's a time for the acetylcholine to get released. So whenever the signal will reach the periphery, there is one ion that will take entry here. The name of the ion is calcium ion. So calcium will take entry in this nerve for the release of acetylcholine. Now guys, there is presence of some proteins. There are presence of some proteins on the surface of this vesicle. We call them fusion proteins. Right? So we have presence of some fusion proteins. We also call them snare proteins. So on the surface of vesicle, we have a presence of some snare proteins. Now snare proteins are also known as fusion proteins. So snare proteins are also known as fusion proteins, which are present on the vesicle membrane, and these proteins are also present on the nerve membrane. So we have two types of snare proteins, two types of fusion proteins present in body. In case you people know the answer, please tell me. Like we have two types of protein. One is known as synaptobravin and one is known as syntoxin protein. So who will tell me where we have the presence of synaptobravin protein and where we have the presence of syntoxin protein? So where we have synaptobravin, where we have syntoxin. So guys, please remember we have the presence of this protein on the vesicle, which are also known as synaptobravin protein. So these proteins are known as synaptobravin protein, and these proteins can be present on the nerve membrane, and the proteins which are present on the nerve membrane, we call them syntoxin protein. So we have a syntoxin protein present on the nerve membrane, and we have a syntaxin protein or syntoxin protein. We have a presence of protein on the vesicle membrane. We call them synaptobravin protein. Now, one of the protein that is present on the nerve membrane is important for your exam. That is SNAP25 protein. Now, one of the nerve membrane protein, that is a syntaxin protein, we call it SNAP25 protein. Right? So what will happen? Whenever the stimulus will reach the periphery of the nerve, the calcium will take entry. Now the calcium will go and bind to this vesicle protein. And when this calcium will go and bind to this vesicle protein, this calcium and the protein complex get activated. So this calcium will activate this vesicle protein or the fusion protein. Now when this calcium will activate this vesicle protein, now this get attracted. This get attracted towards this SNAP25 protein which is present on the nerve membrane. So signal has come from the brain, calcium has taken entry, calcium has gone and activate the vesicular membrane protein, and now this vesicular membrane protein plus calcium complex will get attracted towards SNAP25 protein, and now the fusion will take place. Now the fusion of the vesicle membrane with the nerve membrane will take place. And when the fusion of this vesicle membrane with the nerve membrane will take place, a tunnel is formed and through which acetylcholine is released. So this is how the acetylcholine is released in the body. So first of all, the signal will reach the periphery. The calcium will take entry. Calcium will activate the vesicular protein, and now this get attracted towards the nerve protein, and now the acetylcholine is released. acetylcholine is released from the vesicle, and now the acetylcholine will act on its receptor, which is present on the muscle membrane or wherever it is present. Now, guys, we have an important drug. We have an important drug that will act on this pathway. The name of the medicine is Botox. So we have a medicine, the drug name is Botox. Now, Botox is actually the botulinum toxin. So name of the medicine is botulinum toxin. So botulinum toxin is the name of a drug which is also known as Botox. The brand name of the medicine is Botox. Now this botulinum toxin and the Botox is a drug that is blocker of this SNAP25 protein. So this Botox is a SNAP25 protein inhibitor. So this Botox is a medicine that we use clinically, right? And please remember, whenever we give Botox to a patient, mechanism of action. What is the mechanism of action of this medicine? This is an irreversible inhibitor. So this medicine is an irreversible inhibitor. So this medicine is an irreversible inhibitor of SNAP25 protein. So this is an irreversible inhibitor of SNAP25 protein, and when it will block this protein irreversibly. When I block this protein irreversibly, this medicine can inhibit the calcium-mediated acetylcholine release. This medicine can inhibit the calcium-mediated acetylcholine release from the nerve membrane. So this can block the calcium-mediated acetylcholine release by blocking this protein irreversibly. Right? So this is the mechanism of action of this medicine. And when you block this acetylcholine release, the muscles of the body get relaxed. So muscles will get relaxed by inhibiting the release of acetylcholine from the vesicle. Now, you people have to answer me a few questions. From where we people have obtained this medicine? What is the origin of this medicine, that is Botox? Anyone can answer? What is the origin of this medicine, Botox? Botox ka origin, can any one of you answer me this question? What is the origin of the Botox? From where we have obtained the medicine Botox? So botulinum toxin is obtained from a bacteria. Yes, this is obtained from a Clostridium bacteria. So this is obtained from a Clostridium bacteria. Now this Clostridium bacteria can produce 7 types of toxin. This Clostridium bacteria can produce 7 types of toxin, type A to type F, like type A, type B, type C, D, E, F. Now, which toxin we use most commonly clinically? So guys, please remember, we use type A toxin maximally. Sometimes we use type B toxin also. So Clostridium botulinum is a bacteria from which we obtain this toxin as a drug. And this bacteria can produce 7 types of toxin. Now, out of those 7 types of toxin, type A toxin. Type A toxin is the most commonly used drug clinically, and sometimes we also use type B toxin. And this type A is the one that is the most commonly blocker of the SNAP25 protein irreversibly. So this is how the medicine is originated. Now, guys, who will tell me the route of administration? What is the route of administration of this medicine? Do you know like how the drug is given to a patient? Is this given by local route or the systemic route? Like if you people have to answer me, medicine is given by local route or the systemic route. What is the answer? Can I inject Botox directly in your plasma? Yes, Dr. Jeevan, we have around 10 or 20 times. We have 10 or 20 types of syntoxin and the synaptobravin protein. Like synaptobravin is a name of a class, like it's a group of a protein. Synaptobravin is a group of a protein. So it can be of many types. And similarly, syntaxin is of many types. One of the type is SNAP25. One of the type of syntaxin protein is SNAP25 protein. Right? So I've just mentioned one name because the drug that we use clinically is type A, and type A toxin is typically blocker of only SNAP25. Like we have type B, type C, type D, type F. Those are the actual toxin of the bacteria. Those will act on other type of fusion proteins. So we are mainly concerned about the clinically useful drug, that is a Botox, and many of you have answered correct. The medicine is given by the local route. So this medicine cannot be given by the systemic route. The medicine is given by the local route. Now, guys, I just want to know, this medicine is an irreversible inhibitor of SNAP25 protein. And because the medicine is irreversible inhibitor of SNAP25 protein, what is the duration of action of the medicine? Is this medicine act for a shorter time or the long time? Medicine has long action or the short action? Anyone can answer? Like I have given you sufficient hint. The medicine is irreversible inhibitor. So if any drug is irreversible inhibitor, the medicine action lasts for long time or short time. So medicine action lasts for Long time. Very good. So this medicine action lasts for long time. So this medicine has very long action in the body. This can be seen up till 2 to 3 months. So this medicine is blocker of a nerve protein, and you know that the nerve will take long time to regenerate. If I block the nerve ending irreversibly, the new nerve ending will be regenerated. When the new nerve ending will come, then only the new proteins will come, because the previous block was irreversible. Previous block was irreversible, so the nerve has to regenerate a new nerve ending, and from that only the acetylcholine can come out, and that will take very long time. That medicine action can be seen up till 2 to 3 months. So this is the duration of action of the medicine. Now guys, please remember the dose of the medicine. The dose of the medicine is calculated in units. So dose of the medicine is calculated in units. We do not calculate the medicine dose in milligram, microgram, milliliter or microliter. The medicine dose is calculated in units. And what are the indication of this medicine? Now this medicine is given for many indications. This medicine is given for many indication. One of the indication where we use the medicine, can you please tell me? If you people have covered derma, anyone of you have read derma, you must be knowing the indication. Like in cosmetic clinic, we use Botox. In cosmetic clinics, we use Botox for the treatment of wrinkles. So this medicine is given for the treatment of wrinkles. Ophtha, in ophtha, we can use this medicine for blepharospasm. So in ophtha, we can use the medicine for blepharospasm. So we can use the medicine for treatment of wrinkles, for the treatment of blepharospasm. So for many indications, not only one indication, for multiple indications, we can use the medicines like Botox. So indications are not important because there are many indications these days. It's difficult to make a question. Difficult to make a question where the medicine is used. So better to remember the other properties of the drugs. So what are the other properties of medicine? The most important thing is mechanism of action. Medicine mechanism of action is very, very important. It's an irreversible inhibitor of SNAP25 and can inhibit the release of calcium. This is very commonly asked in your exam. Then they can ask you which toxin is used most commonly. Answer is type A toxin. Next is what is the duration of action of the medicine? Action lasts for long time, and the dose of the medicine is calculated in units, not in milligram and microgram. This is all about acetylcholine synthesis and its release. Now after this acetylcholine synthesis and its release, we can discuss about acetylcholine metabolism. So how the acetylcholine metabolism will take place in the body. So how the acetylcholine metabolism will take place in the body. So acetylcholine metabolism is possible with the help of an enzyme. The name of the enzyme is acetylcholine esterase enzyme. So acetylcholine metabolism will take place with the help of. Okay, there is a question from Dr. Hemant. Sir, acetylcholine vesicle are preformed or it will form after signal from the brain? Hemant, see what happens, it is preformed. So wherever the signal will come from the brain, the previously stored acetylcholine is released and the new acetylcholine gets stored in the vesicle. Right? So previously stored acetylcholine is released and the new acetylcholine formation will take place. So whatever vesicles are emptied and those vesicles are again filled up for the future release. Right? So if you ask me like which phenomena will take place, answer is both phenomena will take place together. The previously stored acetylcholine is released. That's why without any time, like within few milliseconds, the acetylcholine release you can see whenever the signal will come from the brain. Right? Next is acetylcholine metabolism, that is take place with the help of an enzyme. We call it acetylcholine esterase enzyme. Now this acetylcholine esterase enzyme has two active sites. So in the structure of this enzyme, we have a presence of two active sites. So if I draw the structure of acetylcholine esterase, this enzyme has two active sites. So this is your acetylcholine esterase having the two active sites. It's a unique property of this enzyme. This enzyme has two active sites. The first site is having the negative charge. We call it anionic site. The first site is having the negative charge. We call it anionic site. The second site is known as the esteric site, which has the property to metabolize the ester bond. So one is known as anionic site. Second is known as esteric site. Esteric site is the one that has the property to metabolize the ester bond. Now here at the esteric site, there is a presence of an amino acid. We call it serine. So serine is an amino acid which is present at the esteric site. So serine is an amino acid which is present at the esteric site. So we have an anionic site, we have an esteric site. At anionic site, we have a negative charge, and the esteric site, we have a presence of serine, and this can metabolize the acetylcholine. So acetylcholine, which is released by the nerve ending, acetylcholine contains positive charge. Acetylcholine contains positive charge, and acetylcholine also contains ester bond. So acetylcholine contains positive charge. It also contains ester bond. So whenever acetylcholine is released by the nerve ending, this positive side of the acetylcholine will bind to the anionic site, and the ester bond will come and bind to the serine, and this is how the acetylcholine get metabolized. So acetylcholine ester bond is metabolized by the esteric site. So acetylcholine contains positive charge. Positive charge will bind to the anionic site, and the ester bond will come and bind to the serine and get metabolized. So this is how the acetylcholine metabolism takes place in the body. Now guys, if I ask you this question, where we have the presence of acetylcholine esterase present in the body? So answer is this acetylcholine esterase present in synaptic cleft. So acetylcholine esterase present in our synaptic cleft. So if I say, whenever you want to take out the patient plasma sample, whenever you take out patient plasma sample, do you get any acetylcholine esterase enzyme in that plasma? Answer is no. So whenever you take out the plasma sample, acetylcholine esterase, which is present in the synaptic cleft, this cannot come out. So we have a presence of one more enzyme. We have a presence of one more enzyme. We call it pseudocholine esterase enzyme. So we have a presence of pseudocholine esterase enzyme, which is present in plasma. So we also call it plasma esterase. We also call it plasma esterase enzyme. So this is the one that is present in your plasma. So whenever you take out the plasma sample, this is the enzyme that you actually calculate in the plasma. So guys, try to understand. Although acetylcholine is metabolized by acetylcholine esterase, but practically, clinically, we cannot calculate the level of acetylcholine esterase. Now, just like acetylcholine esterase, we have one more enzyme. We call it plasma cholinesterase. This enzyme will come from the liver cells. So liver cells will make this enzyme, and this enzyme is later on secreted in the plasma. Now, whenever we take out the plasma sample, this is the enzyme that we actually check in the plasma. And guys, please remember, any drug which is blocker of acetylcholine esterase can also block this enzyme. Any drug which can stimulate acetylcholine esterase can stimulate this also. So please remember this point. These two enzymes have the same property. The only difference is the location. Acetylcholine esterase present in synaptic cleft, it cannot come out in plasma, and pseudocholine esterase present in plasma, so it's easy to measure. So for all clinical purpose, we measure this enzyme pseudocholine esterase. We do not measure the acetylcholine esterase level. Now, number 4 point in your physiology of cholinergic system. Now, what are the acetylcholine receptors present in body? So if we talk about types of acetylcholine receptors present in human body, so we have two types of acetylcholine receptors. So acetylcholine can act on two types of receptors. We have a nicotine receptor, we have a muscarinic receptor. So we have two types of acetylcholine receptor. One is nicotinic receptor, second is muscarinic receptor. Now we know that nicotine receptor can be of two types. If it is present over neuron, we call it nicotine N. If it is present over muscle, we call it nicotine M. So nicotine receptor, two types. If it is present over nerve, we call it nicotine N. If present over muscle, we call it nicotine M. Now, if we talk about muscarinic receptor is of 5 types. So we have total 5 types of muscarinic receptor, M1 to M5 receptor. So we have total 5 types of muscarinic and 2 types of nicotine receptor present in the body. Total 7 types of receptors are there. Now total we have 7 types of receptors, guys. Please remember, all receptors which are present over here are stimulatory in nature. All these receptors are stimulatory in nature except muscarinic 2 and muscarinic 4, which are inhibitory type of receptors. So muscarinic 2 and muscarinic 4 are inhibitory. The rest of the receptors are stimulatory. So rest of the receptors are stimulatory except muscarinic 2 and muscarinic 4, which are inhibitory type of receptors. So there are 2 receptors which are inhibitory, M2 and M4. The rest of the receptors are stimulatory. Now, if we talk about this nicotine receptor further. Now, nicotine receptor is an ion-gated channel. This is an ion-gated channel. It's an ion-gated receptor. Like whenever this receptor will open, the sodium will take entry in the cell. So this is an ion-gated channel. Whenever this nicotine receptor will open, the sodium will take entry inside the cell. So sodium will take entry inside the cell whenever this receptor will open. So we have nicotine N, nicotine M, two types of receptors which are the ion gated channel. Now, if I talk about where we have the nicotine M receptor present. So if I talk about the location of this receptor, this is present on the surface of all voluntary muscles. So nicotine M receptor is present on the surface of all voluntary muscle. Like one of the example of voluntary muscle is skeletal muscle. So this is present on the surface of all voluntary muscle, that is nicotine M receptor. Now if I draw the molecular structure, of this receptor, this is pentameric in shape. So this receptor is total pentameric in shape, having the 5 subunits. So this is a pentameric receptor, which is the ion gated channel, and this has the 5 subunits. Now, if I draw the 5 subunits, I will draw the 5 subunits like this way. So this is the horizontal section of the receptor. This is the horizontal section of the receptors having the 5 subunits. And in the center of the 5 subunits, this is the pore through which the sodium will take entry. So this is a central pore through which the sodium will take entry. The sodium will go inside through the central pore. These are the 5 subunits. The receptor is pentameric in shape. Now, if I draw the vertical structure, if I see the receptor from front, so I can see only 2 subunits. So I can see only 2 subunits of this receptor when I see it from front. And now the sodium will go inside through the central pore. So this is how the sodium will go inside. This is the central pore. This is the vertical section, and the above is the horizontal section. Now guys, if any one of you is targeting the INSET exam, then they will ask you the names of these 5 subunits. So this is for the INSET people. If you are preparing for INSET exam, they will ask you what are the names of these subunits which are present in this nicotine M receptor. So in this nicotine M receptor, we have a unit like alpha 1. We have an alpha 1 unit, we have a beta unit, we again have alpha 1, then we have the delta, and finally we have the gamma. So we have alpha 1 beta, we have alpha 1 delta, and we have the gamma unit. So these are the 5 units, and we have discussed the names of these units: alpha 1 beta, alpha 1 gamma, and then the delta. Right guys? So they will ask you this question whenever acetylcholine is released. Whenever acetylcholine will come, this acetylcholine will act on nicotine M receptor. What is the binding site of acetylcholine? So where does the acetylcholine will come and bind to this receptor? So the answer is the acetylcholine binding site is, the binding site of acetylcholine is this alpha 1 beta and alpha 1 delta junction. So this is the binding site of acetylcholine. So acetylcholine will come and bind to this alpha 1 beta and alpha 1 delta subunit. This is bind to the junction of alpha 1 beta, alpha 1 delta. So students can remember like this way: after breakfast, after dinner. So after breakfast, after dinner is a mnemonic to remember the binding site of acetylcholine. So binding site of acetylcholine on this acetylcholine receptor is alpha 1 beta, alpha 1 delta junction or the interface. Right? So this is the binding site of acetylcholine on this receptor. Now guys, same is the binding site. Same is the binding site of skeletal muscle relaxants. So we know that skeletal muscle relaxants are the one which are blocker of this NM receptor, and these medicines can relax the muscles by binding to this receptor. So same are the binding site of skeletal muscle relaxants. So skeletal muscle relaxants are the medicines which end with the word curium and curare. These medicines can block this NM receptor, and these medicines will go and bind to the same subunit on the receptor. And because the medicines will go and bind to the same subunit, who will tell me these medicines are considered as which type of blocker? Are these competitive blocker or the non-competitive blocker? If I say skeletal muscle relaxants will go and occupy the receptor and block the receptor, they will go and bind to the same site. They will go and bind to the same site which is required by the acetylcholine for the binding. So are these medicines considered as competitive blocker or the non-competitive blocker? Yes, so we call them competitive blocker. So these medicines are considered as competitive blocker. So these medicines are considered as competitive blocker. So these are considered as competitive blocker because they will go and bind to the same sites. So medicines will go and bind to the same sites. We call them competitive blocker. That is NM blocker. Good. Now guys, let's talk about nicotine N receptor. What is the location of nicotine N receptor? So if we talk about nicotine N receptor, these receptors are present at nerve and nerve junction. So the location of the receptor is nerve and nerve junction. So this receptor is present at nerve and nerve junction, that is nicotine N receptor. So nicotine N receptor present at nerve and nerve junction. Now where we have the nerve and nerve junction present, we have already covered today. In autonomic system, this junction is present in ganglia. This junction is present in autonomic ganglia. But guys, let me tell you, as a doctor, as a clinician, this location is not important for you because uh, we don't have any clinically useful drug that will act on ganglia. We don't have any clinically useful drug that will act on ganglia. So if you cannot remember this location, it's fine. This is not going to be asked in the exam. But the second location of the receptor is very important. Now, guys, we have lot of nerve and nerve junctions. We have so many innumerous number, like unlimited number, infinite number of nerve and nerve junctions present in our central nervous system. So in central nervous system, we have unlimited number of nerve and nerve junction, but in central nervous system, we do not call it ganglia, we call it nucleus. So in central nervous system, we call it nucleus, but in autonomic system, we call it ganglia. The only difference is in CNS, we call it nucleus, and here we call it ganglia, right? So in autonomic system, we call it ganglia. In CNS, we call it nucleus. Now guys, for your examination point of view, you have to remember the name of only one nucleus. You have to remember the name of one nucleus, that is a nicotine N receptor alpha 4 beta 2 type. So the name of a nucleus is nicotine N receptor alpha 4 beta 2 type. Like this is the receptor, which is again a pentameric in shape. And because it is pentameric in shape, this also contains the 5 subunits. This also contains the 5 subunits. And in these 5 subunits, the names of 2 subunits are alpha 4. So names of 2 subunits are alpha 4 and the 3 subunits are beta 2. So we have alpha 4 and beta 2 type of receptor. We have pentameric receptor, which is known as alpha 4 beta 2 type of receptor. And why this name of this receptor is important? Because this is the center of the CNS. This is the receptor of the CNS, which is involved in nicotine addiction. So this is the one that is involved in nicotine addiction. That's why it's important to know the name of the receptor. So the name of the receptor is important because this is involved in nicotine addiction. So whenever patient smokes, patient takes tobacco. So nicotine addiction, this is the receptor which is involved. So all the medicines that we use for nicotine de-addiction, all the medicines that we use for nicotine de-addiction will act on this alpha 4 beta 2 type of receptor. And one of the example of the drug is like vernicillin. So we have a medicine that is vernicillin. So vernicillin is the name of a medicine that is having the word NIC in its name. So it is having the word NIC in its name. So vernicillin is a medicine that we can use for nicotine de-addiction. You can see the name of the medicine is having the word nicotine. So we can use this medicine for nicotine de-addiction. And all the medicines that we use for nicotine de-addiction can act on this receptor, that is alpha 4 beta 2 type of receptor. So this is all about the basic information about the nicotine and nicotine M receptor. Now let's talk about muscarinic receptor. So guys, if we talk about muscarinic receptors, what are the locations of the receptor? If we talk about muscarinic 1 receptor. So one of the important location of muscarinic 1 receptor is GAT. And we know that muscarinic 1 is a stimulatory type of receptor. We discussed that all receptors are stimulatory except muscarinic 2, muscarinic 4. So all nicotinic, all muscarinic are stimulatory except muscarinic 2, muscarinic 4. So M1 receptor present in GAT and it has an important role in acid secretion. So this is a stimulatory receptor. It has an important role in acid secretion, that is a muscarinic 1. Now muscarinic 1 receptor is also present in central nervous system. So this receptor is also present in central nervous system. So this receptor is present in central nervous system, and in central nervous system, the important role of the receptor is to maintain the body movements. This has an important role in the maintenance of the body movements. And whenever there is an overactivity of the receptor, the patient can have tremors. Patient can have tremors. So patient can have tremors whenever this receptor is overactive, and this receptor is also involved in learning and memory. So this receptor also has an important role in learning and memory. So muscarinic 1 receptor has 2 locations. One is central nervous system, where it has an important role in learning and memory, plus the tremors, and it also present in GAT, where it has an important role in acid secretion. Now let's talk about muscarinic 2 receptor. Now muscarinic 2 receptor is a type of inhibitory receptor, and one of the important location of this receptor is heart. So one of the important location of the receptor is heart. And whenever we stimulate this receptor, we know that it's an inhibitory type of receptor, so the heart rate will decrease. So it's an inhibitory receptor, so the heart rate will decrease via muscarinic 2. Now, where we have the muscarinic 3 receptor? So answer is muscarinic 3 receptor is present on the surface of all smooth muscles. So all smooth muscles and all glands of the body. So all smooth muscles and all glands of the body. So all smooth muscles and all glands of the body, we have the presence of muscarinic 3 receptor. And because this is a stimulatory type of receptor, this can contract. This can cause contraction of all smooth muscles and can increase secretion of all the glands of the body. So this can increase the secretion of all glands and can result in contraction of all smooth muscle. So muscarinic 3 present over all smooth muscles and glands, muscarinic 2 present over heart, muscarinic 1 present in GAT and CNS, and the locations of muscarinic 4 and 5 are not important for the exam because we do not have any medicine that act on muscarinic 4 and muscarinic 5. So muscarinic 4 and 5 are not important, so we'll not discuss in detail. So this is all about the locations of the receptors. So guys, if you have any doubt, please ask. So what we have discussed so far, like if we go back and see what we have discussed so far, we have started with types of nerves. So which nerves are cholinergic nerves? That first of all we discussed. Then we discussed how the acetylcholine synthesis will take place. There we talked about a very important drug, that is Botox. So Botox we have discussed in detail. Then we discussed how the acetylcholine is metabolized. There we talked about this enzyme that we use clinically for all the measuring purpose, pseudocholine esterase enzyme. But in actual, acetylcholine is metabolized in synaptic cleft by the acetylcholine esterase. Then we discuss acetylcholine receptors, their properties, and the locations of the receptors. After this knowledge, we can talk about the acetylcholine actions in the body. So what are the various types of actions that can take place in the body? So what are the acetylcholine actions that will take place in the body through this multiple types of receptors? So we talk about the locations. Based on these locations and based on the properties, let's talk about the acetylcholine actions. Now, acetylcholine can act on nicotine M receptor. This can act on nicotine N receptor, and this can also act on muscarinic receptor. So by acting on nicotine M receptor, we know that this will help in skeletal muscle contraction. So nicotine M receptor present on skeletal muscle. So this can result in skeletal muscle contraction. But there is one special property of this receptor. If this receptor get overstimulated, so if this nicotine M receptor get overstimulated, so if this nicotine M receptor get overstimulated, the body has a mechanism to temporarily down-regulate the receptor. So body can down-regulate the receptor, and when this receptor get down-regulated, the receptor temporarily become desensitized. So whenever we stimulate the skeletal muscle excessively, whenever this receptor get overstimulated, then the down-regulation of the receptor will take place. Down-regulation means the receptor, number of receptors on the surface of muscles. Number of receptors on surface of muscles will decrease. So body will down-regulate the receptor. Now as a result of that, overstimulation of this receptor leads to muscle relaxation. So overstimulation of the receptor leads to muscle relaxation because this receptor body does not want to stimulate excessively. Otherwise, this will lead to rupture of tendon. So guys, please remember, like there is a huge table in front of me right now. So if I want to lift this table, with my hands, so I cannot lift it because if my muscles will try to lift a heavy object, my tendons and my muscles have to get contracted. But if the thing is out of my reach, like if I cannot lift this heavy object, so ultimately what will happen if I keep on trying, a stage will come when my tendons get sewed, when my tendons get ruptured, I will have the pain in my muscles. So body has a mechanism. Whenever you overstimulate any receptor, that is NM receptor, the body will down-regulate this NM receptor, and instead of contraction, the muscles get temporarily relaxed and muscle will not respond to the acetylcholine. This is what happens when we give a medicine to a patient. We call it succinylcholine. Now, succinylcholine contains two successive molecules of acetylcholine. Succinylcholine is a medicine that contains two successive molecules of acetylcholine, and whenever I give this medicine to a patient, this will excessively depolarize the muscles. This will first of all depolarize the muscle, and after excessively depolarizing the muscle, this will cause muscle relaxation. So this will cause depolarizing. This is known as depolarizing muscle relaxant. So this is different type of muscle relaxant. So this will cause depolarizing type of muscle relaxation because succinylcholine contains two molecules of acetylcholine, and because of the excessive acetylcholine, this will overstimulate the NM receptor. So initially the patient will have contraction. Initially the patient will have muscle contraction, but within few seconds the receptor get down regulated and patient will have the muscle relaxation. This is the property of NM receptor. Now let's talk about the nicotine N receptor. Now one of the important location of nicotine N receptor is CNS, right? So we know that whenever acetylcholine will act on nicotine N receptor, this will result in nicotine addiction. So this can result in nicotine addiction. So acetylcholine, or whenever we stimulate this receptor, not acetylcholine, whenever we stimulate this receptor has an important role in nicotine addiction. And guys, one more thing is, whenever we stimulate this receptor, our learning and memory centers, our learning and memory center get also stimulated. So learning and memory get stimulated via muscarinic 1 that we discussed above, and that is also stimulated by nicotine N receptors. And studies have shown this thing. Smokers or the tobacco chewers. So smokers or the tobacco chewers, they do not suffer from dementia. So smokers and the tobacco chewers, they do not suffer from dementia because they keep on stimulating their learning and the memory center. So nicotine N receptor, the same receptor that is involved in nicotine addiction, is also present in your learning and the memory center. So if you people smoke, if you people take tobacco, then your memory will increase. You will not have dementia in your life, but you will have the oral cancer or the lung cancer. So oral cancer, lung cancer risk is there, but your learning and memory will never get fade out. So guys, you are preparing for the entrance exam. If you want to improve your learning and memory, you can start these kind of things temporarily. And after these exams are over, you can stop taking these medicines. Right? So you can nebulize the things. I mean, nebulization means smoking. You can nebulize the cigarette, you can take the tobacco, you can chew the tobacco, your learning and memory will be better. Like, guys, any one of you chew tobacco? Which brand of tobacco is best these days? Which brand of tobacco is best? Like, I have seen advertisement of Vimal. Vimal is there, Rajnigandha is there. Rajnigandha, Vimal. Yes. So nicotine patch we also use for nicotine de-addiction. I told you, whenever we have to make a patient de-addict, we have to use the same receptor, nicotine N receptor. So which brand is better, guys? Tobacco का कौन सा brand better है? Rajnigandha is better or Vimal is better? Or any other brand is better if you people consume? I think the Vimal is better because that contains kesar. Kesar is there in Vimal. Vimal में there is a kesar. Star Gutka, Maruti, Parliament. अरे ये ब्रांड्स है क्या इसके? Yes, Ajay Devgan consume Vimal. Even Akshay Kumar also consume Vimal. और अब तो शाहरुख खान, अक्षय कुमार. Now recently one more film star has started taking Vimal. There is a film star. One question is, why is it difficult to use skeletal muscles while laughing? Arey, you use skeletal muscles while laughing. I mean, I have not understood the question exactly. So while laughing, we use the facial muscles. Like, look at this. Ha, 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 ha. So I'm using my facial muscles. With the help of facial muscles, I'm laughing. Although my brain component is also there. My brain component is also there. My brain has some humor in it. So when my brain will receive that particular environment as a humorous, then I have this feeling of laughing. So my facial muscles will help me to laugh. I can also laugh like this way. So without using my facial muscle, I can laugh like this way also. Like when doing some other work while laughing. We can use other work also, guys. Like while laughing, we can use other work. Like you can see me, ha 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 ha. You can see my hands are moving, ha 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 ha. This kind of things can be done. Okay, let's talk about muscarinic receptor. So by acting on the muscarinic receptor, what kind of actions can be seen? So the via muscarinic receptor, the actions can be. Is it so? My second laugh was like a Shah Rukh Khan. Now we got to know that Shah Rukh Khan used to have this Vimal in his mouth. You know, Shah Rukh Khan used to have Vimal in his mouth, then he used to laugh like this. Hmm? And this way, Shah Rukh Khan can also laugh like this way. Huh? No? He's having this Vimal in his mouth. Okay, now next is, guys, muscarinic receptor. So muscarinic receptors, the action can be dumbbells. So you can remember with the mnemonic, that is dumbbells. So while the muscarinic receptor, we have a dumbbells. So what is a full form of dumbbells? Acetylcholine will act on muscarinic receptor. We will have a dumbbells over here. So in this mnemonic of dumbbells, guys, please remember acetylcholine by acting on muscarinic receptor. All the actions are due to muscarinic 3 receptor. All the actions are due to muscarinic 3 receptor, but only the bradycardia that we'll discuss in this mnemonic. Bradycardia is due to M2. All the actions are due to M3. So all the actions are due to M3, but bradycardia is due to M2. So guys, here the D stands for diarrhea. So acetylcholine will act on muscarinic receptor, can increase the peristalsis, can result in diarrhea. Now acetylcholine can also act on muscarinic receptor, can result in dilatation of the blood vessels. So this can result in dilatation of the blood vessels, and when the blood vessels are dilated, the BP will fall. So D stands for diarrhea, D stands for dilatation of the blood vessels. So D stands for diarrhea, D stands for dilatation of the blood vessels. Now this dilatation of the blood vessels will take place because acetylcholine will act on muscarinic 3 receptor and can stimulate one enzyme. We call it endothelial nitric oxide synthase enzyme. So acetylcholine will act on muscarinic 3 receptor, stimulate endothelial nitric oxide synthase enzyme that will form nitric oxide in blood vessels. Now this nitric oxide that is formed in the blood vessel, this will stimulate guanyl cyclase enzyme. This will stimulate guanyl cyclase enzyme. This guanyl cyclase enzyme will increase cyclic GMP, and this cyclic GMP can inhibit the myosin light chain. This can inhibit the myosin light chain, and when you inhibit the myosin light chain, the smooth muscles of the blood vessel get relaxed. So acetylcholine can act on muscarinic receptor, can result in actions that we can remember with the mnemonic dumbbells, where the D stands for diarrhea, D stands for dilatation of the blood vessels, and therefore the BP will fall. So here the acetylcholine will act on muscarinic 3 receptor, stimulate nitric oxide synthase enzyme, release the nitric oxide. Nitric oxide will increase the level of guanyl cyclase. Guanyl cyclase will increase cyclic GMP, and this will inhibit myosin light chain, and therefore the blood vessels get relaxed. Right? So guys, in this experiment, to prove that acetylcholine can cause vasodilation by nitric oxide, this nitric oxide was first time discovered. So nitric oxide first time discovered in this experiment, and scientists got Nobel Prize. Scientists got Nobel Prize to prove this nitric oxide component that is involved in the vasodilation. That's why this particular point is very important. So this particular point is very important, where the medicines can cause dilatation of the blood vessels, or acetylcholine can cause dilatation of the blood vessel, and therefore each and every step is asked in your exam. So this is very important point, how the blood vessels are dilated by the acetylcholine. So in this mnemonic, U stands for urination. So acetylcholine can cause urination. So U stands for urination. Now the M stands for meiosis. So acetylcholine can cause meiosis. This will contract the eye muscles. This will result in meiosis. But along with meiosis, this will also contract the lens muscles. So this will contract the lens muscles as well as the iris muscle. So acetylcholine can contract the iris muscle, and by contracting the iris muscle, this will cause meiosis. Particularly, this will contract the circular muscle of iris. So by contracting the circular muscle of iris, this will cause meiosis, and this will also contract the lens muscle, which is also known as ciliary muscle of lens. So this will contract the ciliary muscle of lens, that will cause accommodation. So this will contract the ciliary muscle of lens, can result in accommodation. So meiosis will occur because of contraction of the circular muscle of iris, and accommodation will occur because of the ciliary muscle of lens that is contracted. So guys, whenever the ciliary muscle of lens is contracted, please remember the lens will become more convex. The lens will become more convex, and in this process, we required it for near vision. Like guys, if I draw the structure, the lens is normally like this way. Lens is normally like this way, and this is the ciliary muscle. So this is the lens and this is the ciliary muscle. Now whenever this ciliary muscle will contract, whenever the ciliary muscle will contract, the lens will become more convex. So lens will become more convex in this process whenever the ciliary muscle will contract, and this is known as the process of accommodation, and we required it for near vision. So acetylcholine, mnemonic is dumbbells, which is very, very important to remember. D stands for diarrhea, D stands for dilatation of the blood vessel, U stands for urination, M stands for meiosis with accommodation. Meiosis with accommodation. Now guys, let's talk about the letter B. Now B stands for bradycardia. So acetylcholine can result in bradycardia. So acetylcholine can cause bradycardia, so heart rate is reduced. So acetylcholine can cause bradycardia when the heart rate is reduced. Now this is due to muscarinic 2 receptor. This is due to muscarinic 2 receptor that will take place in the body. Now B also stands for bronchospasm. So B also stands for bronchospasm. So acetylcholine with the help of muscarinic 3 receptor increase the tone of the bronchiole, and by increasing the tone of bronchiole, this will cause bronchospasm. Now the next is E. The E stands for erection. So erection will take place in males. Erection will take place in males because of the acetylcholine. So acetylcholine will act on muscarinic 3 receptor and again release nitric oxide in penile blood vessels. So penis blood vessels, penile blood vessels get dilated. So when the penile blood vessels get dilated, vasodilation that will take place in the penis blood vessels. So vasodilation will take place in the penis blood vessels, and because of the penis blood vessels which are dilated by nitric oxide, this will cause erection. So guys, please remember, in males the erection is possible whenever the males are relaxed and the parasympathetic system is activated. So when the parasympathetic system is activated, patient's CNS has the libido. So libido means the interest in sexuality. So patient libido is high. So patient has arousal, patient libido is high. Plus this parasympathetic system that will release acetylcholine, and with the help of acetylcholine, the nitric oxide is released. Then only erection is possible. So then only erection is possible. So CNS is important as well as the parasympathetic system is important for erection. So erection is possible in males when both components are present together. If any of the component is missing, erection is not possible. Guys, have you seen any male who is in stress and having the erection? Like have you noticed any male fighting with someone and in between the fight the male has got erection? Like the boxing championship is going on and other opponent is just pushing, just giving you so many punches, and in between you will say, wait opponent, I have got an erection. So erection is not possible whenever you are in stress. Whenever there is a stressful events or any event is going on, erection is not possible. Right? Erection is only possible when the males are relaxed, their parasympathetic system is activated, and they have the high libido in their mind. Then only erections are possible. Who will tell me the most common cause of erectile dysfunction? So what is the most common cause of erectile dysfunction? Can any one of you tell me? What is the most common cause of erectile dysfunction in males? Anyone can guess? Next is, we have a letter LSS. You can see the mnemonic LSSS, triple S. So we have a lacrimation, salivation and sweating. So we have lacrimation, we have salivation, and we have sweating also. So we have lacrimation, salivation, sweating. This is possible because all the glandular secretions are increased. So all the glandular secretions are increased. So this is possible. And now this S also stands for secretion of acid. So secretion of acid in GAT is also possible. Now secretion of acid in GAT is again due to M3 receptor, but M1 is also involved. So M1 is also involved in that, right? So M3 is most commonly involved, but M1 is also involved in secretion of acid. Yes, the most common cause of erectile dysfunction is the anxiety. So most common cause of erectile dysfunction is the anxiety or the stress. The stress or the anxiety is the most common cause of erectile dysfunction, because for the erection, you should have this relaxed mind, then only it's possible. Very good. So most of you have given the correct answer. So this is all about the full core dumbbells, which is very, very important to remember for your examination point of view. So guys, we have covered the physiology of cholinergic system up till here. How many of you have understood? How many of you understood up till here? How many of you understood this topic up till here? And if you people have any doubt, please ask. So if you have, yes, Dr. Kelly, I'm not promoting any addiction. I'm not saying to take I'm not saying to take nicotine. I'm just saying if you take nicotine, your memory will not be lost, but you will have the oral cancer. I've also given a disclaimer that people will have the oral cancer if you chew tobacco. If you smoke, then you will have the lung cancer. So I'm not promoting this nicotine, guys. Don't take it otherwise, right? Okay. Now, based on this knowledge, guys, let's start with the drugs. So if we talk about the drugs which will act on this parasympathetic pathway. So we talk about the medicines which will act on this pathway. So we have two types of medicines. We have two types of medicines which can act on this pathway. The first type of medicines are known as cholinergic drugs. First type of medicines are known as cholinergic drugs. Weed we will discuss later on CNS. When I teach you psychiatry, then in psychiatry I will teach you how to make the patient de-addict. We'll discuss the treatment of addiction, like how to make the patient de-addict of nicotine, de-addict of weed, de-addict of alcohol, opioids, all these things, right? So right now we're going to discuss two types of medicines that will act on our parasympathetic system or the cholinergic system. We have the cholinergic drugs and we have some anti-cholinergic medicines. So we have cholinergic medicines and we have anti-cholinergic medicines. So we have cholinergic medicines and we have some anti-cholinergic medicines. Now cholinergic drugs, as the name suggests, these medicines will result in dumbbells as the effect in the body. So these medicines can result in dumbbells as the effect in the body, and the full form of dumbbells we already know. D stands for diarrhea, D stands for dilatation of the blood vessels, U stands for urination, M stands for meiosis with accommodation, B stands for bradycardia, bronchospasm, E stands for erection, L stands for lacrimation, salivation, sweating, and S also stands for secretion of the acid. Now the anticholinergic drugs are those medicines which will do opposite of dumbbells. Now these medicines will do opposite of dumbbells. So anticholinergics will do opposite of dumbbells. So we have dumbbells and we have an opposite of dumbbells. So we are going to start with the medicines which are cholinergic drugs. The medicines which are cholinergic drugs, these medicines can lead to actions which are dumbbells. Now these medicines can further be of two types. Cholinergic drugs can further be of two types. These medicines can be directly acting, medicines can be indirectly acting. So cholinergic drugs further of two types. Medicines can be directly acting, medicines can be indirectly acting. Now directly acting medicines are those medicines that will directly act on muscarinic receptor. That will directly act on muscarinic receptor. Yes, Dr. Supriya Patil, you can see over here, whenever acetylcholine is released in the body, whenever acetylcholine is released in the body, this acetylcholine can act on NM receptor. This is our somatic system. This is not our parasympathetic system. This is our somatic system. And the same acetylcholine, when increased in the CNS, this will lead to this action. And this is a central action. This is not the parasympathetic activity. This is our central activity. So we have a central activity. We have a somatic activity. This is our parasympathetic activity. So this is our parasympathetic activity. I hope it's clear now. So parasympathetic action is dumbbells. But acetylcholine, Dr. Supriya, try to understand. acetylcholine is a common chemical of our body. If it is increased in the body, it will be increased everywhere. Like it will be increased in parasympathetic nerves, it will be increased in somatic nerve, it will also be increased in the CNS because the patients suffer from that disease. So according to the disease process, this can be increased everywhere. And Dr. Supriya, one more thing you have to understand. The problem here is the common neurotransmitter is acetylcholine. You can see here, everywhere acetylcholine is a common neurotransmitter. And that's why the students always get confused because these are interlinked with each other. All the three systems are interlinked with each other. But every time you will find the receptors are different. So according to the receptors, you will decide your drug. Right? So this is what we have discussed so far. That's why I've taken so much time to explain you these medicines, these things in detail. Because if your physiology concepts are thorough, then only you can understand the drugs. So we are discussing cholinergic drugs, which can be of two types: directly acting, indirectly acting. Now, directly acting medicines are those medicines which will directly act on muscarinic receptor, and by acting on muscarinic receptor, these medicines can result in dumbbells as the effect. Now, medicines which are indirectly acting. Now, medicines which are indirectly acting, these medicines are inhibitor of acetylcholine esterase enzyme. So, whenever you give these medicines are acetylcholine esterase enzyme inhibitor. So, by blocking the acetylcholine esterase enzyme, these medicines will inhibit the metabolism of acetylcholine. So, acetylcholine will stay in the body for a long time. So, indirectly acting medicines, inhibitor of acetylcholine esterase enzyme. So by blocking this enzyme, they will increase the level of acetylcholine in the body. And when this acetylcholine is increased in the body, now again you can see Dr. Patil. So whenever you increase acetylcholine in the body, acetylcholine can act on three types of receptor. It can act on muscarinic receptor and can result in parasympathetic activity like dumbbells. Now this can also act on nicotine N receptor and can improve your learning and memory. So this can improve your learning and memory also. And this can also act on nicotine M receptor and can improve your skeletal muscle strength. Right? So this can also improve your skeletal muscle strength. So there are two group of medicine. Directly acting will only act on muscarinic receptor. Indirectly acting will act indirectly on all the three types of receptor: muscarinic, nicotine, and the nicotine M receptor. So guys, who will tell me? Like if the patient suffer from Alzheimer's disease, so in treatment of Alzheimer's, which group of medicines are used? Directly acting, indirectly acting. So my question is, patients suffer from Alzheimer's disease, where the patient will have the dementia. So which group of medicines are used? So in treatment of dementia, which group of medicines are given? Indirectly acting or directly acting? Very good. So we'll use the indirectly acting medicine. Now, if a patient suffer from myasthenia gravis, patient will have the muscle weakness. Skeletal muscles are weak. Myasthenia gravis, which medicines are given? Directly acting, indirectly acting. Answer is again indirectly acting. So in this way, guys, you have to decide the medicine. You have to, in this way, you have to choose the medicine for a particular disease. So according to the disease process, you can use the medicine. So like whenever you want to improve the muscle strength, you again use indirectly acting. You want to improve the patient memory, you will use the indirectly acting. But whenever you want to have the dumbbells as the effect, in the body, then you can choose the muscarinic as a directly acting medicines or indirectly acting medicine. Both type of medicines can be used. Right? Let's start with the medicines which are directly acting. Now, the medicines which are directly acting, these medicines are further of two types. There are two medicines which are important for your exam. So medicines that will lead to dumbbells as the effect. These medicines are total two which are important for your exam. One is known as bithenecol. So first medicine is known as bithenecol. Second medicine is pilocarpine. So pilocarpine and bithenecol are the two medicines which are known as directly acting medicines. Now you can see from this medicine name bithenecol, this medicine name ends with the word cholinergic. So this medicine is a cholinergic drug. So you can see from its name bithenecol, this medicine is a cholinergic drug. Right? So this medicine is a cholinergic drug having a word chol in its name. It's a cholinergic medicine. Second thing, this medicine name starts from the alphabet B. So this medicine can go and stimulate the bladder. So this medicine can lead to bladder contraction, and with the bladder contraction, this is the medicine that will help in that urination. So in dumbbells, we know that the U stands for urination. So bethanechol is a medicine that starts with letter B. This will stimulate the bladder and can cause the contraction of the bladder, result in urination, and it's a cholinergic medicine. Now, because this medicine can stimulate the bladder and can result in bladder contraction, this is considered as drug of choice. This is considered as best medicine or the drug of choice for atonic bladder. So any patient suffer from atonic bladder, hypoactive bladder, this is a drug of choice. So this medicine is drug of choice for atonic bladder and hypoactive bladder. So whenever the patient bladder is hypoactive, patient does not have any urge to pass urine. So patient does not have any urge to pass urine. So patient bladder muscles are weak. Patient will not have urge to pass urine because bladder muscles are not contracting at all. And when this patient bladder muscles are not contracting at all, patient will not have urge to pass urine. The bladder get overfilled. So bladder get full, and because of the accumulation of urine in the bladder, so that will lead to accumulation of urine in the bladder. And because of the accumulation of urine in the bladder, kidney is normal. Kidney is making the urine. Urine is coming to the bladder, but bladder is not contracting. So that will lead to accumulation of urine in the bladder, and that will start causing the overflow of the urine from the bladder. And when this urine will start overflowing, we call it overflow incontinence. We also call it overflow incontinence. So this is overflow incontinence. We also call it atonic bladder. So why we call it overflow incontinence? Because kidney is normal. Kidney is making the urine. Urine is coming to the bladder, but bladder is not contracting. So there the urine is accumulating in the bladder, but sphincter of the bladder has a capacity to hold the urine to a certain limit. So when that limit of the sphincter is crossed, like when the urine accumulation is so much that the limitation of the sphincter to hold the urine is crossed, then this will start the overflowing of the urine, and this is known as overflow incontinence. Now guys, why the patient bladder is inactive, why the patient bladder muscles are not contracting? There may be the multiple reasons. Maybe the patient suffer from some neuropathic disorder. So the nerves which carry the sensation from the bladder to the brain, the nerves that will carry the sensation or the nerves that will bring the reflexes from the brain to the bladder. So those nerves are missing. So those nerves are not working properly. Patients suffer from neuropathy. Patients suffer from neuropathy. Patient may be suffering from a patient has got some spinal cord injury. Patient has got some spinal cord injury, and that will also lead to spinal cord injury. That will also lead to the trauma to the nerves. So the nerves are missing, and that is not taking the sensation from your bladder to the brain, and also not carrying the reflexes from the brain to the bladder. So spinal cord injury, neuropathy can be there. Patient may be taking some drugs. So many drugs side effect is neuropathy. For example, patient may be taking TB drugs, isoniazid. Isoniazid will lead to neuropathy. HIV drugs can lead to neuropathy. So multiple reasons can be there for the neuropathy. Diabetes. Patient may be suffering from diabetes mellitus, diabetic neuropathy. Maybe patient suffering from CKD. So in CKD patient will have the uremia. So in uremia, patient will have the neuropathy. So multiple reasons can be there for the neuropathy. So many reasons for the neuropathy like malnourishment, vitamin B deficiency, spinal cord injury, drug side effect, diabetes mellitus, CKD, multiple reasons for the atonic bladder, and we can use the medicine bethanechol as a drug of choice for that. Number 2 condition where we use the medicine, because this medicine can contract the bladder, this is considered as drug of choice. So this medicine is considered as drug of choice for post-operative retention of urine. So post-operative retention of urine, this medicine is a drug of choice. So post-operative retention of urine after surgery, if the patient is not able to pass urine. After surgery, if the patient is not able to pass urine, this medicine we can use to stimulate the bladder, and now the patient is able to pass the urine. So post-operative retention of urine, this medicine is a drug of choice. Now, what is the most common reason? What is the most common reason for post-operative retention of urine? The most common reason for post-operative retention of urine is the electrolyte imbalance. So because of the electrolyte imbalance, the patient is not able to pass urine in post-operative room. Electrolyte imbalance is the most common reason because patient is NPO. Patient is NPO before surgery, and also there is a loss of blood during the surgery. And because of this loss of blood during the surgery, patient suffer from electrolyte deficiency or electrolyte loss, electrolyte imbalance. So NPO and the blood loss are the two main reasons for the electrolyte imbalance after surgery. And this may be the reason why the motor nerves are not able to work properly and patient can have the post-operative retention of urine. For the same reason, whenever the patient is not able to pass the urine in post-operative room, we start the electrolyte therapy. So we start the ringer lactate. So ringer lactate is a treatment of choice. So we start the fluid therapy. Ringer lactate is a treatment of choice. We give this ringer lactate to a patient for 24 to 48 hours. We give ringer lactate to the patient for 24 to 48 hours. And if the electrolyte balance is maintained, even then the patient is not able to pass urine, then you have to use the medicine that is bethanechol. So bethanechol is given if the electrolyte, even after correction of electrolytes, the patient is still not able to pass urine, then you can give a medicine to the patient after 24 to 48 hours of the fluid therapy. So fluid therapy is the treatment of choice. But even after fluid therapy, patient is not able to pass urine, and you are working in a government hospital and you want to vacate the bed because the other patient is waiting to get admitted in the government hospital, right? Then you can give bethanechol to the patient. The patient will pass the urine, and now you can discharge the patient from the hospital. So drug of choice for post-operative retention of urine is bethanechol. Now, if we talk about the medicine side effect, now this medicine can cause dumbbells as a symptom. So one of the important side effect of this medicine is bronchospasm. So bronchospasm is one of the important side effect of the medicine. And because of the bronchospasm, medicine has contraindication. So this medicine should not be given to a patient of bronchial asthma and COPD. So in bronchial asthma and COPD patient, this medicine is contraindicated. So medicine can cause bronchospasm as a side effect and should not be given in patients of bronchial asthma and COPD. So we have covered one medicine, that is bethanechol. Now bethanechol is a medicine. Bethanechol is a medicine that starts with alphabet B. This medicine starts from alphabet B. This medicine is given to stimulate B, that is bladder. So medicine is given to stimulate B, that is bladder. And this medicine side effect is also B, that is bronchospasm. And this medicine contraindication is also B, that is bronchial asthma. So medicine contraindication, medicine side effect, medicine indication, medicine name. All starts with B. This is all about the medicine bethanechol. Now after this bethanechol, guys, we have other medicine, that is pilocarpine. Now let's talk about pilocarpine. Now guys, pilocarpine is a medicine. This medicine is more or less given nowadays in the form of eye drops. So this medicine is given in the form of eye drops. Now this medicine starts from alphabet PI. Now because this medicine starts with alphabet PI, this medicine when given in the eye drop form, this medicine will make the pupil pinpoint. So this medicine can make the pupil pinpoint. So PI stands for pinpoint pupil. So this medicine can make the pupil pinpoint, and pinpoint pupil means the size of the pupil is very small. This is also known as meiosis. The size of the pupil is very small. This is known as meiosis. So pilocarpine will cause pinpoint pupil and cause meiosis. And whenever this medicine will cause pinpoint pupil or meiosis, this will cause peripheral angle widening. So we have a peripheral angle of the eye that get widened. There is a peripheral angle widening that will take place. Now guys, we are talking about which angle? We are talking about an angle. This is also known as iridocorneal angle. So that angle is known as iridocorneal angle. So this medicine can result in iridocorneal angle widening. So widening of iridocorneal angle that will take place. Now because of the peripheral angle widening, this will lead to increased pouring. This will lead to increased pouring of aqueous humor. This will lead to increased pouring of aqueous humor in trabecular tissue. So we have a presence of trabecular tissue just posterior or just behind that angle. So guys, if I display that photograph in front of you, then this is the photograph. You can see in this photograph, right? We're talking about this angle. Can you see this angle, guys? This is the cornea and this is the iris. So we have a cornea, we have an iris. So we're talking about this angle. So this is the iridocorneal angle. So this is the iridocorneal angle, and there is a trabecular meshwork. Trabecular meshwork present just behind this angle. So if a drug will cause meiosis, this angle will get open. This angle get widened. And because this angle get widened, now the aqueous humor can easily drained in this trabecular meshwork. But whenever there is a mydriasis, like you can see, the pupil has gone away from each other. When the pupil has gone away from each other, iris muscle is known as pupil basically. Iris muscle is known as pupil. So when the pupil has gone away from each other, this is mydriasis. So during the mydriasis, you can see the angle get closed. So during the mydriasis, you can see the angle get closed. The trabecular meshwork drainage is not possible, and now the aqueous humor drainage is not possible. Right? So what we have discussed so far? We have discussed so far the drug name is pilocarpine. Now pilocarpine is a drug that will make the pupil pinpoint. So this medicine can make the pupil pinpoint and therefore the peripheral angle of the eye. Peripheral angle of the eye, that is known as iridocorneal angle. This angle become wide. So pilocarpine starts with PI. This will make the pupil PI and this will cause widening of the peripheral angle, that is the iridocorneal angle, and this will result in increased poring. This will result in increased pouring of aqueous humor in the trabecular tissue, and because of this increased pouring of aqueous humor in the trabecular tissue, this will reduce the pressure in the eyes. This will reduce pressure in the eyes. The pressure is known as intraocular pressure. So pressure in the eyes will reduce. The intraocular pressure in the eyes will reduce, and we can use this medicine. We can use this medicine as a first line drug. We can use this medicine as a first line drug for the treatment of acute angle closure glaucoma. So I can use this medicine for the treatment of acute angle closure glaucoma, where the problem lies in the angle. The angle is narrow, and because the angle is narrow, the trabecular meshwork remain occluded by this angle, and this remain closed by this angle, so that the aqueous humor drainage is not possible. So if you open up this angle, the aqueous humor drainage will start, and this medicine is given as a first line drug for acute angle closure glaucoma. So pilocarpine is given as a first line medicine for angle closure glaucoma. The drug name is pilocarpine. So pilocarpine starts with P and everything starts with P. This will make the pupil pinpoint. Peripheral angle is widened. Pouring of aqueous humor will take place and the intraocular pressure in eyes will reduce. And the medicine important indication is it is given as a first line drug for angle closure glaucoma. Now what can be the side effect of this medicine? So whenever we give this medicine in the form of eye drop, this medicine can lead to 4 side effects that also start from alphabet P. So medicine 4 side effects starts from alphabet P. Number 1, this medicine can make the pupil pinpoint. So this medicine can make the pupil pinpoint, and when this medicine will make the pupil pinpoint, patient vision remain deteriorated. So patient cannot see the things clearly. Patient vision remain deteriorated till the time the medicine action is present in the body. So because of pinpoint pupil, patient vision remain deteriorated. Number 2, this medicine can cause muscle spasm. This medicine will cause muscle contraction. Because of the muscle contraction, this medicine can cause pain in eyes and pain in head. So because of continuous muscle contraction, like this can contract 2 muscles of the eyes. We discussed already. This will cause iris muscle spasm that will result in miosis, and that will also cause lens muscle spasm. So because of the iris muscles and the lens muscle spasm, so both iris as well as the lens muscles will remain in spasm, and because of the iris and the lens muscles remain in spasm, patient can have pain in the eyes, pain in the head as a side effect. Number 3, this medicine can also cause a side effect. We call it peripheral retinal detachment. This medicine can also cause a side effect. We call it peripheral retinal detachment. So peripheral retinal detachment is an important side effect of the medicine. So how this medicine can cause peripheral retinal detachment, you can see. Now, you can see this is the ciliary muscle. So I'm just writing as CM. CM stands for ciliary muscle. Now, ciliary muscle is a muscle of lens. So this will make the lens more convex, and this is required for the near vision. So this is a ciliary muscle, and ciliary muscle has a body. We call it ciliary body. Now, ciliary body has a function to secrete the aqueous humor. This ciliary body has a secretory epithelium. So this is a secretory epithelium. With the help of that, this can secrete the aqueous humor in the eyes. So ciliary body secrete aqueous humor. Ciliary muscle will make the lens more convex, and therefore it is required for the near vision. Now some of the fibers of ciliary muscle will go till the retina also. So from here the retina will start. So this is the retina. So retina will start from this ciliary body onwards. And some of the fibers of the ciliary muscles are attached with this retina. Now, whenever the ciliary muscle will contract, this can pull the retina. And when this will pull the retina, this will take away some of the fibers along with it. So whenever the ciliary muscle will contract, this ciliary muscle can pull the fibers of the retina, layers of the retina, and can cause peripheral retinal detachment. So this is the peripheral part of retina. This get detached. So we call this side effect as peripheral retinal detachment. So medicine side effect is pinpoint pupil. Medicine side effect is pain in the eyes, pain in the head, because iris muscles and the lens muscles will be contracted. Medicine can cause peripheral retinal detachment. Number 4 side effect, this medicine can cause punctum blockage. This medicine can result in punctum blockage as a side effect. Now guys, punctum is the opening of nasolacrimal duct. This is the opening of nasolacrimal duct. So we can say like this way, this medicine can cause nasolacrimal duct blockage. So we all know this point. Whenever we put any eye drop, whenever we put any eye drops, all the eye drops will go to nasolacrimal duct. So all the eye drops have the tendency to go to nasolacrimal duct. And when this pilocarpine will go to nasolacrimal duct, this will act on muscarinic receptor, increase the tone of the smooth muscles of the nasolacrimal duct, and can cause the closure of the opening of the nasolacrimal duct. So this will cause the closure of the opening of the nasolacrimal duct, and this will result in punctum blockage. So this will result in punctum blockage, nasolacrimal duct blockage as a side effect. So nasolacrimal duct blockage, the opening of the nasolacrimal duct is blocked. So these are the 4 important side effects of medicine. Starts with P. The medicines can lead to pinpoint pupil and the vision remain deteriorated. Medicine can cause pain in the eyes. Medicine can cause peripheral retinal detachment, and the medicine can cause punctum blockage. So in bethanechol, guys, everything starts with B, and in pilocarpine, everything starts with P. This is all about directly acting medicine. This is what we have discussed. So we have started with cholinergic drugs that will lead to dumbbells as the effect, and medicines can cause direct action or the indirect action. And direct action medicines we people have covered. Now let's talk about indirectly acting medicines. So in next 5-10 minutes we'll take a break. So let's start with indirectly acting medicine, then we'll take a break, right? And give you an introduction of indirectly acting medicine, then we'll take a break. So let's talk about indirectly acting medicines. So if we talk about indirectly acting medicines, we people have covered that these medicines are acetylcholine esterase enzyme inhibitor. So these medicines are acetylcholine esterase enzyme inhibitors. Now these medicines can be of 2 types. So indirectly acting medicines inhibit acetylcholine esterase, increase the level of acetylcholine, and can result in various actions in the body that we have already covered. Now these medicines which can block acetylcholine esterase can be of 2 types. Now these medicines can be reversible inhibitor of acetylcholine esterase enzyme. Medicines can be irreversible inhibitors. So medicines can be reversible inhibitor of this enzyme. Medicines can be irreversible inhibitor of this enzyme. So medicines can be reversible inhibitors. Medicines can be irreversible inhibitor of this enzyme. Now, reversible inhibitors are clinically useful medicines. The medicines which are irreversible inhibitors, these medicines are poisons for human beings. So irreversible inhibitors are the poisons for human being. So these medicines are irreversible inhibitor. These medicines are poisons for human being that we'll discuss later on. Now the medicines which are reversible inhibitor, these medicines by inhibiting acetylcholine esterase enzyme, they can increase the level of acetylcholine in the body. And by increasing the level of acetylcholine in the body, these medicines can stimulate nicotine N receptor and can improve the patient memory. So these medicines can improve the patient memory, and these medicines are given for the treatment of dementia. So these medicines are given for the treatment of dementia because medicines can improve the patient memory. So medicines can improve the patient memory. Medicines are given for the treatment of dementia. So what are the drugs that belong to this class? So we have 3 medicines belong to this class. Number 1 is known as donepezil. So we have a medicine, the drug name is donepezil. Now donepezil is a medicine that starts from alphabet D. This medicine starts from alphabet D. This is the best medicine for dementia. This is the best medicine for dementia. D is for donepezil. D is for dementia. Now this medicine is the most efficient drug. This is the most efficient drug for the treatment of dementia, and that is why it is known as drug of choice. This is known as drug of choice for dementia. Drug name is donepezil. The medicine which is reversible inhibitor of acetylcholine esterase, stimulate the memory center. It's a most efficient drug of choice for dementia. Now this medicine is given by oral route. So drug is given by most comfortable route, that is the oral route. The patient compliance is also very good. And this medicine dose modification. This medicine dose modification not required. This medicine dose modification not required in patients of CKD and CLD. So medicine dose modification not required. medicine dose modification not required in patients of CKD, that is a kidney disease, or in patients of CLD, that's a liver disease. So in patients of chronic kidney disease, chronic liver disease, we do not require its dose modification, and that's why this medicine is a wonderful drug to be used. The drug name is donepezil. So donepezil is the most efficient drug to use for dementia. The drug is given by oral route. Its dose modification not required in patients with CKD, CLD. The drug name is donepezil. But the important side effect of this medicine is diarrhea. So we know that this medicine can lead to dumbbells as the effect in the body. So whenever you give this medicine by oral route, the most common side effect of the medicine is diarrhea, because this medicine will come in direct contact with muscarinic receptor of GIT. And when this medicine will come in direct contact with muscarinic receptor of GIT, the medicine can result in diarrhea as the most important side effect. Now, because this medicine can cause diarrhea as a most important side effect, you give the medicine to a patient, and when the patient will come back to you after 2 to 3 weeks, you will ask the patient whether his memory is increased or not. Patient will say, sir, my memory is not increased because I cannot come out of the washroom. So patients stay back to the washroom in last 2 to 3 weeks. So patient will say, sir, my memory is not increased in last 2 to 3 weeks. Rather, I have very bad memories of last 2 to 3 weeks, which I cannot explain in the OPD. So because of this diarrhea, this medicine has a drawback. This will lead to non-compliance. The medicine is given by oral route. So guys, what we can do as an alternative of this? So we people have discovered one more medicine. We'll discuss one more side effect of donepezil, so you can leave some space in between. So we have discovered one more medicine, that is rivastigmine. So rivastigmine is a medicine that we have discovered. Now rivastigmine is a medicine. This medicine is given in the form of skin patch. So we can give this medicine in the form of skin patch. And whenever we give the medicine in the form of skin patch, the GAT side effects. So GAT side effects are drastically reduced. I will not say GAT side effects are almost become nil, but GAT side effects are almost become nil. Like it's not absolutely zero, it is minimal. So GAT side effects can be reduced if you give rivastigmine in the form of skin patch. So when the donepezil is given by oral route, the side effect is diarrhea, which you can overcome by giving a rivastigmine. So any patient who cannot tolerate donepezil, we can give rivastigmine in the form of skin patch. Now the second side effect of this medicine is this medicine can lead to nightmares. So this medicine can lead to nightmares. This medicine can lead to mood swings as a side effect. So we know that we have a muscarinic receptor present in CNS. So whenever we stimulate the muscarinic or the nicotine receptor in CNS by this acetylcholine, this can stimulate the central nervous system activity, can result in nightmares, can result in mood swings as a side effect. But guys, in Indian OPD, nightmares and mood swings, I don't know why, but this is not given much importance. So like assume you are a physician, you are a neurologist, you are sitting in AIMS OPD. The AIMS Delhi OPD, 1,000 patients are around you, and one of the patient has come to an OPD and saying कि sir, मुझे mood swings हो रहे हैं, sir मुझे nightmares आ रहे हैं, मुझे बुरे सपने आते हैं. So guys, you just throw that patient out of the OPD, because you will say कि ये देखो 1,000 patients around me and these patients can hit me anytime. So this is the nightmare which I'm actually facing throughout the day. So you are having nightmares at night time, I'm having the nightmares throughout the day. So this is not a symptom. So guys, Indian OPD में ना mood swings, nightmares are not will not get much importance, right? But India में we have a problem of शौचालय. We don't have the शौचालय, and because we don't have the शौचालय, so diarrhea is the big side effect. So diarrhea is the important side effect in India. That's why we people have found an alternative of diarrhea, not the nightmares. So nightmares, mood swings will be there, one more side effect. But diarrhea we can overcome. Diarrhea problem we can solve by giving the rivastigmine. So we can give the rivastigmine in the form of skin patch. We have one more medicine that we can use for dementia. The third medicine is galantamine. So we have one more medicine. The drug name is galantamine. So galantamine is a medicine that we can also use for this condition, that is dementia. So galantamine can be given, rivastigmine can be used, donepezil, 3 medicines that we use for the treatment of dementia. So for donepezil, guys, you can remember like this way. This medicine name starts with D. This is given for D, dementia, and this medicine dose modification not required. So donepezil, best medicine for dementia, dose modification not required in CKD, CLD, and this medicine important side effect is diarrhea. So medicine important side effect is diarrhea. So everything starts with D. The drug is donepezil. Dose modification not required. Diarrhea is a side effect, and this medicine is drug of choice for dementia. Now let's talk about the second group of medicine, the medicines that will act on the medicines which are given to stimulate the nicotine M receptor. So medicines are inhibitor of acetylcholine esterase, increase the level of acetylcholine, and now the acetylcholine will act on nicotine M receptor. So by acting on nicotine M receptor, the medicines can improve the strength. These medicines can improve the strength of our skeletal muscles. So these medicines can improve the strength of our skeletal muscles. So this can improve the strength of our skeletal muscle by acting on nicotine M receptor. Now these medicines are peripherally acting drugs. So these medicines will not act on CNS. So these medicines have peripheral action only. These medicines have no CNS action. So our muscles are present in periphery. So we have intentionally made these medicines only peripherally acting. The medicines will not act on CNS, and this is due to their quaternary structure. So we say that these medicines have quaternary structure. Now because of the quaternary structure, these medicines will only act in periphery. The medicines will not act on CNS, and medicines have only action on the skeletal muscle, will not act anywhere else. So what are the drugs which belong to this class? So we have a medicine that belong to this class. The drug name is pyridostigmine. So we have a medicine, the drug name is pyridostigmine. So pyridostigmine is a medicine. This medicine can improve the muscle strength. And because this medicine can improve the muscle strength when given to a patient, this medicine has a long action in the body. This medicine has a long action but having the slow onset of action. Medicine has slow onset of action but having the long action. So this medicine is given for the maintenance treatment of those conditions. So MXTX stands for maintenance treatment. So drug is slow acting, having the long action. This medicine is given for maintenance treatment of a condition like myasthenia gravis. So I can use this medicine for the treatment of myasthenia gravis. Now myasthenia gravis is a condition where the patient muscles are weak. Where the patient muscles are weak and patient cannot lift his arms, cannot lift his arm to make new friends in life. So whenever you have to make new friends in your life, you have to lift your hand, forward your hand, shake the hand with a person and take the hand back, right? So in patients of myasthenia gravis, you cannot lift your hand. So if you take pyridostigmine, this is a long acting medicine having the slow action, and this will give you strength so that you can lift your hand and you can make dost in your life. So you can make dost in your life. So if you really want to make dost in your life, take pyridostigmine. So pyridostigmine has the word dosti in its name. So this medicine will help you to make the dost in your life. This medicine gives you strength in your hand. And if you have strength in your hand, then you can make many dost in your life. And this medicine gives you strength for a long time. Medicine gives you strength for a long time, and medicine is also slow acting. So slow action, long lasting action will make you dost, give you strength in your hands. So boys, do you have strength in your hands to make dost in your life? Boys in this batch, do you have strength in your hand? So myasthenia gravis, pyridostigmine is a medicine that's a drug of choice. So pyridostigmine, drug of choice for myasthenia gravis. Now, this medicine is also given for one more disorder where the patient muscles are weak. We call it Lambert-Eaton myasthenia syndrome. So we have a Lambert-Eaton myasthenia syndrome. Lambert-Eaton myasthenia syndrome is a condition where the patient muscles are weak. Should I write the full form of Lambert-Eaton myasthenia syndrome? Lambert-Eaton myasthenia syndrome, again the patient muscles are weak. We can use pyridostigmine. To improve the muscle strength. So medicine is given for myasthenia gravis. Medicine is given for Lambert-Eaton myasthenia syndrome. If anybody knows how to, if anybody knows the full form of LEMS, you can type in the group for the other students. Because there are many students among us who do not know the full form of Lambert-Eaton myasthenia syndrome, LEMS. Can you write the spellings of Lambert-Eaton myasthenia syndrome for the students? Okay, now we have one more drug that belongs to this class. The drug name is neostigmine. So we have one more drug. The drug name is neostigmine. Now guys, neostigmin is a medicine which starts with the word new. So guys, please remember, new generation, new people, or new things are always fast. So this basic advantage of using the medicine is this medicine has fast onset of action. This medicine has fast onset of action because this drug is new. So new stands for this medicine has fast onset of action. So medicine has fast onset of action, and also this medicine is the second longest acting medicine of this class. This medicine has second longest action and having the fast onset of action, and because of the fast onset as well as the long action, I can use this medicine for both condition. I can use this medicine for acute emergency as well as I can use this medicine for maintenance treatment. So this medicine is given for both acute emergency as well as for maintenance treatment because the medicine has fast action as well as the second longest action. So given for both condition, acute emergency as well as for maintenance treatment. So in conditions, guys, where you want to improve the muscle strength, in conditions where the patient muscle strength are gone, you want to improve the muscle strength immediately, acutely, at a very fast speed, then this neostigmin is a preferred medicine. MXTX means maintenance treatment, like OPD. Guys, what is OPD full form? Like in hospital, we run two types of department. One is a emergency department, one is a OPD. What is OPD full form? In OPD, we give maintenance treatment. In emergency department, we give the acute emergency treatment. So what is OPD, guys? Do you use this word OPD in your hospitals? Very good. Outpatient department. So outpatient department, the patient comes in a stable state and we give medicines for maintenance treatment. Yes, so there are some conditions where you want a fast improvement of the muscle strength, like whenever the patient is bitten by cobra. So whenever patient is bitten by cobra, you want the fast recovery of the muscles. We can use the medicine neostigmin because at that time we don't have time. Your patient is in emergency, so you have less time, so you can use neostigmin. Now, neostigmin is also used as a medicine to gain the muscle strength. It's a drug of choice for reversal. It's a drug of choice for reversal of skeletal muscle relaxant. So this is the first line medicine, drug of choice for skeletal muscle relaxants. Now, skeletal muscle relaxants are those medicines, if you remember, the medicine's name end with the word curium. So medicine's name end with the word curium. Now, these medicines are inhibitor of the NM receptor. Now, you want to stimulate the NM receptor. We discussed that these medicines are the competitive blocker. We discussed that these medicines are the competitive blocker of this receptor. And when you want to overcome this competitive block, you have to increase the level of acetylcholine. So neostigmin, by increasing the level of acetylcholine immediately, within a very short span of time, this medicine can lead to fast recovery immediately after surgery. So after surgery, if you want to reverse the skeletal muscle relaxant effect, you want to extubate the patient. You want to extubate the patient. You want that patient should start breathing by himself, and you can shift the patient to the post-operative room. So that reversal is done by using the medicine that is neostigmin. Right? Now, apart from this, pyridostigmin and neostigmin, two medicines, we have one more medicine. The drug name is edrophonium. So the third medicine belong to this class is edrophonium. Now, edrophonium is a medicine which is having the word drop in its name. So guys, please remember this medicine action will drop. This medicine action will drop very early. So very short duration of action. So action will drop at a very fast speed. So this medicine has very short action. The medicine action lasts for few minutes only. Now, because of the short action, I cannot use the medicine for treatment. The patient compliance will not come. Patient will not be comfortable in taking medicine again and again. Patient will not be comfortable in taking the medicine again and again. So medicine has short action, right? So action drop at very fast speed. The action is very fast. I mean, the action will stop at a very fast speed. So I will use this medicine only for diagnosis. So I will use this edrophonium only for the diagnosis of myasthenia gravis. I will not use this medicine for maintenance treatment. I will use this medicine only for diagnosis of myasthenia gravis, not for the maintenance treatment. And the test that we use is known as tensilon test, also known as ameliorative test. So the test is known as tensilon test. So the test that we use for making the diagnosis of myasthenia gravis, where we use the medicine edrophonium, the test is known as tensilon test. So with the help of tensilon test, we can make a diagnosis of myasthenia gravis. But nowadays, nobody uses this test. That's why this test is less important for the exam. Just remember, adrophonium, the action will drop. The action will drop at a very fast speed. This is a short-acting medicine. So pyridostigmine helps to make those. Neostigmine is new. It's a fast-acting medicine. And adrophonium action will drop at a very fast speed. Dr. Basit Salam, pyridostigmine is not a drug of choice for LEMS. You can say this is a second drug of choice. We have a better medicine for Lambert-Eaton syndrome that we'll discuss later on. When I teach you all these things in detail, then these things will come. That we'll do after the break. So I'm just giving an overview of the medicine's name and their role. We discuss each and every condition in detail after the break. Don't worry. Right? Okay. Now we have a third group of medicines that we have already covered. The medicines that will inhibit acetylcholine esterase enzyme, increase the level of acetylcholine. Now, acetylcholine will act on the muscarinic receptor and can result in dumbbells as the effect. So, this medicine can lead to dumbbells as the effect. Now, this medicine has action present at everywhere in the body. So, this medicine can act at CNS. Medicine can also act in periphery. So, this medicine can cross blood-brain barrier. The medicine can stimulate muscarinic receptor in CNS, as well as medicine can stimulate this receptor in periphery. Right? So the drug name is pyridostigmine. Sorry, the drug name is physostigmine. So we have a medicine over here. The drug name is physostigmine. So physostigmine is a medicine. So the technical team is saying the YouTube में जो limit है that is going to be reached. The YouTube limit is going to be reached for the lecture. So this lecture is soon going to be end. The free airing of the lecture is soon going to be end. So the drug name is physostigmine. So let's finish it fast. Physostigmine is a medicine that will act in CNS as well as act in periphery. And this medicine can stimulate the muscarinic receptor. So I will use this medicine as an antidote of choice. I will use this medicine as an antidote of choice for a condition where the muscarinic receptor is overblocked. So antidote of atropine poisoning. So it is used as an antidote of atropine poisoning. Now guys, atropine is an anticholinergic drug. Atropine is an anticholinergic drug, and because this medicine is an anticholinergic drug, this medicine can block the muscarinic receptor excessively. This medicine can block the muscarinic receptor excessively. So guys, please remember, atropine starts with A. Atropine starts with A. A stands for anticholinergic. So this medicine is an anticholinergic medicine which can block muscarinic receptor excessively, and patient will have symptoms like one of the important symptom is CNS stimulation. So this medicine can cause CNS stimulation, can result in hallucinations. So can result in hallucinations as a part of CNS stimulation. Plus this medicine can also result in oppositodumbbals. So patient will have the symptoms like oppositodumbbals. And patient will also have the CNS stimulation in atropine poisoning, anticholinergic poisoning. And guys, please remember, physostigmine is a medicine that will stimulate the muscarinic receptor. So here the muscarinic receptor is overblocked. You can open up the muscarinic receptor by increasing the acetylcholine. This is used as an antidote of choice. Now this atropine is an active component of belladonna. So this is derived from a belladonna plant. So we also call it belladonna poisoning. Atropine poisoning is also known as belladonna poisoning, and this is also present as an extract in the datura fruit. So this atropine poisoning is same as datura poisoning. So datura poisoning, belladonna poisoning is atropine poisoning. So datura poisoning, belladonna poisoning is atropine poisoning, where the muscarinic receptor is overblocked, and you can open up this receptor by giving the medicine physostigmine. So physostigmine is a medicine. You can see from its name, this medicine is having the word sosti. Like guys, in case you people understand Hindi, susti means when the CNS is going down. So sosti is the word that we use in Hindi to suppress the CNS activity. So please remember, in atropine poisoning, the CNS is stimulated, and physostigmine can suppress the CNS. This will give you susti. And CNS will go down. If you understand Hindi, this mnemonic is for you. And this medicine is used as an antidote of choice for atropine poisoning, belladonna poisoning, datura poisoning. So guys, students mostly get confused between two drugs. One is pyridostigmine, one is physostigmine. You can see from here, pyridostigmine is having the word dosti. So this will help you to make dost. This will give strength to your hands. It's a drug of choice for myasthenia gravis, and this will only act in periphery. This will only act in periphery, not in CNS. Physostigmine suppress the CNS, so it is a central acting medicine. It's an antidote of choice for atropine poisoning. So this is the brief introduction of the medicines, which are the reversible inhibitors. So these medicines are the reversible inhibitor of acetylcholine esterase enzyme, and we'll discuss all these clinical conditions stepwise manner, like what are the guidelines, how to treat Alzheimer's disease, how to treat dementia, how to treat myasthenia gravis, how to treat snake bite. All these things we'll discuss in detail after the break. So guys, we people have covered this medicines. So 2.5 lecture is there. So to YouTube people who are listening this lecture on the YouTube, we just want to say goodbye to them. And YouTube people, in case you people have really liked this lecture, so you people can join us at DBMCI. So our approach is totally clinical. We'll teach each and everything clinical so that you will become a good doctor tomorrow. You will able to solve all the recently asked MCQs, because nowadays the trend is to ask the clinical questions in the exam. Guys, in case you people have any doubt, YouTube people, you can message me directly on this number. So you can WhatsApp me on this number in case you people have any doubt. This is for the WhatsApp. In case you people have any doubt, you can directly WhatsApp me on this number. Take care of you guys. We'll meet again. DBMC people, we are not going to separate. We are here only for you. We'll meet after 20 minutes. So come back after 20 minutes at 12 o'clock. So 12 o'clock, 12 noon sharp, we'll come back.